Now, keep in mind this, when I submit the grade, I have to submit all the documentation, meaning that your point value and so on, of you and the whole class. So I can't say Kiani A, Danielle A, and then John Doe, like F. No, that doesn't work that way. So whatever good points you guys have, I will put them down, and I will, everything you guys have, all the points, and I submit to the department. So they will have that as well. And then, so once you guys see the grades on Canvas, always check to see what you guys have on Canvas. Once it goes on Canvas, I don't change it. But if you see your Scantron with a different score from Canvas, let me know. I don't make mistake. I haven't made mistake yet. Knock on wood. Fake wood, but that's okay. So knock on wood and so on. I haven't made a mistake yet. Okay. I don't intend to, but things happen because I'm older. Okay. So moving on to the next one. So we finished this, right? Okay. We finished this. Now, this is where we left off. Yes. Okay. Special features of the bones right here. Let's go with number one. Sella turcica. Does that ring a bell, guys? Sella turcica. Yes. Now, where should it be? It should be right here. Let me show you where it's at. So this Sella turcica is right here. Wait, give me one moment. So Sella turcica is right here, guys. This is Sella turcica right here, yes? So this right here it houses the pituitary gland. I'm gonna start here and I'm gonna go around. So this is really cool. So Sella turcica houses the pituitary. Can you guys see this bar or no? Can you see it? No, okay. Okay, so I'm gonna lose this space. Okay, so that's okay. That's okay. I can deal with this. So Sella is like a kid in a candy store. It's I feel like houses the pituitary gland. Are we okay in this? All right. Now, can you guys see this, or should I have a light on? Okay, but if I have a light on, you guys will have a hard time seeing that.
I think like that's fine.
Okay. Oh, that's the only. I think that's the only option we have. So, okay. We don't really have another option. Okay, how's pituitary gland? Remember the condition I gave you yesterday, the acromegaly, the gigantism? It's a tumor in the pituitary, right? And this is how they access the tumor in the pituitary. They go through the nose. This is an actual procedure. They go through the nose and they break the sphenoid sinus to access the pituitary. So they put an instrument through your nose and they break the sphenoid sinus right here. This is the sphenoid sinus right here. And they access the Sella turcica, which contains the pituitary. And that is very uncomfortable, but it must be done. The petrous region, have you seen this in the lab from yesterday? You should have, right? It's right here. Look at where my pointer is at. Petrous region. I mentioned this yesterday. What could you find in the petrous region? Make me proud. A bone within a bone. Which bone am I looking at? Petrous region, or petrous part. That's okay. So the petrous region itself, it contains, part or region doesn't really matter. It contains the middle and inner ear, and also houses the ossicles of the middle ear. Does that ring a bell from yesterday? Ossicles, yes. And by the way, the ossicles are the smallest bone in the body. Okay, so if I were to ask you this question on exam, I say this on exam. If I say, name the bone that houses the smallest bones of the body, what would it be? Name the bone that houses the smallest bone in the body. What bone is this?
Features?
Peaches region is not a bone. It's a
Temporal.
bone structure,
Temporal
right?
bone.
Which structure does it belong to? Which bone does the structure belong to?
Temporal.
Temporal. Does that make sense? So if I ask you the question, it says, name the bone to which the smallest bones in the body could be found within, the answer would be the temporal bone. Does that make sense? Okay, good. Touch the little bump that you have on the back of your head. External occipital protuberance, right? Very good. If I ask you on the question on the exam, it says, I said that there's a little bump on the back of your head. To which bone does that bump belong to? And the answer would be your occipital. Does that make sense? So that is something that you can expect on the upcoming exam. Are we okay? Yes? Yes.
You have to write that whole like external. Could we just write?
No. So it's how I asked the question on the lecture exam, right? So I will give you options. Right? I will give you, A, B, C, and D, and then A would be occipital bone. B, yeah. But on the lab exam, I would say name this structure. You have to write out the whole name.
Got it.
Okay? Are we okay on this? Bless you. Are we okay on this?
It went away.
Are we okay on this? Yes?
Yes.
Okay, good. Now, superciliary arch. Have you seen that before? Please say yes. Okay, which bone can you find that on? All right, touch yours. Just touch your. Okay, what bone is that?
Frontal.
Frontal, right? Are we okay? Good. The root and the bridge of your nose. Touch the root of your nose, the tip of your nose. Move it. What is that? What tissue is that?
Cartilage.
Cartilage. Which type? Hyaline. Hyaline cartilage. Okay, good. That's okay. You rather make the mistakes now, but not the exam, right? That's good. And then the next thing is this. So it's hyaline cartilage. Now I want you to move up along the bridge of your nose. Halfway, it becomes hard. Yes or no? That will be the nasal bone. Are we okay? So we can say the root and the bridge of your nose. So we go up the. So actually, no. I made a mistake on this. Ready? Okay, I made a mistake on this. So touch the tip of your nose. Go up along the bridge of your nose and go all the way to the end of the nose where it connects with the frontal bone. That is the root of your nose. Are we okay?
Where this
Frontal
is
nasal.
the frontal bone. that's
Yeah,
the-
where the nasal bone connects with the frontal bone. Where they break during a nose job. Yeah. Yeah, it's painful, but for the price of vanity. Any question on this? We can move on, right? Good. Okay, next one is this. Touch that little bump behind your ear. Which bone does it belong to? You know that it's called mastoid process, right? I went over in lab yesterday. Yes, that little bump behind your ear. So on the exam, I would say something like this. I touch that little bump behind my ear. To which bone does it belong to? So, well, you know it's mastoid process. Yes, it belongs to the
Temporal.
temporal bone, right? Are we okay? Mastoid process belongs to the temporal bone. Are we okay? So, zygomatic arch. Touch your zygomatic arch. Okay, now here's the thing is this. Back in the old days, at least back in the old days, they always say this. They said models have high cheekbones. Their cheekbones are here. When they say high, what does it mean? Are they up to here? It's not a cheekbone. It's the arch of this arch right here. Okay, so let me just tell you something. Make a little note on this. Okay, so they use the word zygomatic arch. Remember yesterday I showed you this. Yesterday, I showed you this piece right here, right? And I said this is the zygomatic bone, and I said this is the temporal bone. Correct? And so when I asked you the two pieces right here connected, this is known as the zygomatic arch. So you have two bones, the zygomatic and the temporal. And when you fuse them together, that piece right there is called a zygomatic arch. This consists of A and B. A would be known as temporal process, of the zygomatic bone, and B would be zygomatic process of temporal bone. Does that make sense? A and B. Right, Enya? Yes. Enya, do you want to move closer so you can see?
I'm copying it.
Okay. Because Odette can she share this.
No, I can't manage it.
No, come closer so you can see, because I feel like you're missing out, like you can't see things. If you want Odette, you can use mine. Oh no, but then it blocks it. You can put it right there. Yeah, you can put a box right there. Oh, be careful, yeah, on the bottom. Don't scare me. Because the stuff that we have in there are very pricey, right? And if that cheap box breaks, okay. The nasal septum. Okay, so what we have is this, the nasal septum. So touch your nose, and I want you to move your nose left to right, and you can feel that there's a piece the nasal septum can move, right? Okay, so let's make a note. This comment is this: nasal septum. Okay, what it is this: it's a wall. The nasal septum is a wall that divides the nasal cavity into two compartments. Let me draw for you what it looks like, right? So this is my nasal cavity right here. And I'm going to add something for you. 1 piece, 2 piece, and I don't have something else. So I'll add 3. Okay. So there are 3 pieces combined. So the nasal septum is composed of 3 structures. 3 structures. And I hope you can remember all these 3 structures is this. 2, 3. First one, perpendicular plate of the ethmoid. Number 2, the cartilage. And number 3, the vomer.
You're going in order of before you drew it, right? 1,
Yeah,
2,
1, 2, 3, yeah. Now, what we can also say is this, we can make a comment on this as well. We can say that, so, if you remember I made a comment on this, and I said when we die, the cartilage decomposes, so this piece disappears, right? So you see the little gap in between 1 and 3. But also, if I were to ask you this question, is this, ready? What bone is this? Even though it's a piece, it's a bone structure, what bone does it belong to? Ethmoid, right? Okay, so if I were to ask you this question, is this. The nasal septum contains, don't copy, just don't copy. Here's what I want you to do is this. If I give you an example question, right? Don't copy, think, and answer the question. Once I'm done, I'll step to the side. You can take a picture however you want, okay? But don't copy and waste ATP. Contains bones of the axial and appendicular skeleton. True or false?
True.
This is for sure false. Appendicular skeleton. All right, no, right? Okay, now, that's false, right? So there's even no need to copy anything down. You know that's false. That is so false. Okay.
True.
True or false?
True.
Why? Which one of that is the facial bone? Vomer, right? Which of that is the cranial bone?
Ethmoid.
Ethmoid. So this is a part of the cranial bone, and this is a part of the facial bone, yes? So the answer is correct. So you want to take a picture of that? That's up to you. But that is something I tend to ask as well, like, or the type of question I would ask on the second exam. Okay? Because I expect you to know the bones, right? And this is a simple question that that will kind of expect that you know your bones well enough. Okay, next one is this, the hard palate. Okay, I showed this to you last week. So by the way, this is the nasal septum, right? I showed this to you last week, not this week, last week. And this is your hard palate, yes or no? Okay. So I went over with you and I said there are two palates, the hard and the soft. Now do me a favor, this. Get your tongue and push up. Push up against the palate. Touch the palate with your tongue. Is it hard? Yes. Push all the way to the back. Try to get your tongue all the way to the back and push up against the back. It's a bit soft, yes or no? So the palate, there are two palates that you have. You have the hard palate and you have the soft palate. The soft palate is going to be more muscular than the hard palate. The hard palate is bone. Now, there are two bones that make up the hard palate. The first one is going to be known as your maxilla and your palatine. Which one's which? If I were to ask you this question, it says, using your directional terminology, describe the position of the palatine in reference to the maxilla. How would you describe it?
Posterior.
This will be anterior, and this is posterior. Agree or disagree? You can't disagree with facts. Look at that picture right here. It says, this is the maxilla right here. This is the palatine. This is the front, this is the back. Yes or no? You can't disagree with that. So on the exam, I would say the palatine is posterior to the maxilla. The answer is yes, right? Good. Any question on this before I move on? Yes?
For the zygomatic arch, if you asked what bone, could we say temporal bone, or you want us to say
well, if
the
I were
processes?
to ask, yeah, if I were to ask you this question, is which bone makes up the zygomatic arch? Which bones? Two of them. Zygomatic and temporal, right?
Yeah.
Right? Am I losing you guys?
No. So you'd
Man.
want us to say both and then
It
either
depends on
do-
the question,
Okay.
right? Okay, so let's do this again, guys. Man, do you have a question for me?
Sorry to interrupt. Kiani, she cannot handle the pain.
Okay, Kiana, just go.
Go.
Yeah, you go. That's fine. Guys, if you have any health issues, just send me an email. That's okay. It's missing class because of health issues, fine. I'm very understanding of those. Yeah. Yes. I wish you take care of yourself. Okay, Kiana?
I'm just sad because I want to do well on the test.
But you get the notes and yeah. Okay, so the zygomatic arch is composed of two things, right? The front and the back, yes or no?
Yes.
So the front is going to be what's known as the temporal process of the zygomatic bone, and the back would be the zygomatic process of the temporal bone, correct?
Yes.
So what I could ask you on this question is this. I would say, what I could ask you is this. Name the two bones forming the zygomatic arch. Take care of yourself. Okay, so name the two bones forming the zygomatic arch.
Okay.
Okay, or I could say this: name the two bone structures forming the zygomatic arch. Does that make sense?
Yes.
Okay.
Okay.
Take a picture, guys. I'm not. Yeah. All right, any question on this before I move on? Any question on this before I move on? We're good to go, right? Okay, good, good. All right, so let's continue where we left off. Okay, so moving on. Okay, so the hyoid is the next one, the hyoid. Okay, so look what the function of the hyoid. It acts as a movable base for the tongue. So the muscle to the tongue actually does help to attach to the hyoid. But here's what I want you to know more so is this. Touch your hyoid, touch your Adam's apple. Yes, we all have Adam's apple. Now go up as far up as you can. There should be a bone called a hyoid. Now what it does is this, is that when someone dies, they also always examine the hyoid to see if there's any suspicious activity involved. And one thing you can think of is strangulation. So if it's broken, the main suspicion would be strangulation is the cause of the death of the person. And so here's what I think how it happened to this, because I would know how the whole process is, right? But when someone strangles someone, if the hand is big enough, I mean everything's crushed. But if your hand is smaller and you actually strangle someone, it would go up, right? Because people can't resist after watching so many movies, right? Law and Order. So not movies like how to kill people, but you know, like TV shows, right? So what happens is that this one right here is the one that can be broken, so it will be crushed. And so that will be the hyoid, and you have one hyoid. That's it, just one hyoid. Now moving on to the next one is this vertebral column. Okay. So vertebral column is also known as your spine. And look at the functions of your spine. It surrounds and protects the spinal cord. So the spinal cord goes in here, guys. So look at this right here. The spinal cord goes inside here. Transmits the weight of the trunk to the lower limbs. All the weight comes down, yes or no? So on the exam, if I say transmits the weight upward, no. All the weight is transmitted down. Does that make sense? Serves as attachment site for muscles of the neck and the back. That's obvious. So the 26 vertebrae held in place by ligaments. So let's make a note on this. So there are 5 regions to the vertebrae. So I'm going to move to the next one right here. So there are 5 regions to the vertebrae. So the vertebrae consists of 5 vertebrae. There are 26 bones altogether. And this is divided into 5 segments. And the 5 segments are going to be known as cervical. Touch this as I say it. Cervical is the neck region. Thoracic would be a part of your thorax. Lumbar would be a part of the lumbar region. So that would be the lower back. Sacral is the lower back. And coccygeal is the tailbone. Okay, now I'm going to give you a few examples of this. Can you guys see back there or no? Yeah?
Not really.
Not really? Okay, alright, okay, that's okay. I'll go back up here then. I was hoping that I could go down. But that's okay. Okay, so that's okay. Let's do it again. Okay, so we have the vertebrae, or the spine, consists of 26 bones. And the vertebrae divides into 5 segments. 1, cervical. 2, thoracic. 3, lumbar. 4, sacral. 5, coccygeal. Now, a lot of you guys that we went over last week, you guys were accustomed to the word sacrum, right? Sacrum is a noun, sacral is an adjective. Coccygeal is an adjective, coccyx is a noun. Okay, so just different forms, okay, but they are the same thing, different forms. I bet you anything, most of you guys have not seen this before. I bet you anything. I bet you anything, all of you guys have seen both forms, right? And I'm pretty sure a lot of you guys don't know the distinction between the two forms, which is okay, because a lot of them, they use them interchangeably. And the vertebral column, now the way you name these is this. Cervical, you go C1 all the way to C7. So there are 7 of these. Thoracic, you go from T1 all the way to T12. Lumbar, you go L1 all the way to L5. Sacral is going to be this S because there's only one. But I want to make a little note on this. There were 5. The sacrum is resulted from the fusion of 5 individual bones. So 5 bones fuse together to give you one sacrum. And the coccyx is resulted from the fusion. So I read different books and they said anywhere between 3 to 4 bones fuse into one. And the coccyx, you already know, is the tailbone, right? Now, I want you to make a note as well as this, is that if you look at the coccyx, the vertebral column, can I open your box? Let's see. Yeah. So if you look at the vertebral column, what we can see is this. Can I open? Yeah. Okay, so here it is this. Wonderful. And I'm going to see if you have a sacrum or not. You might not have a sacrum. Yes, you do. So, this is beautiful in this case is this. All right, so this is a sacrum, and this is a coccyx. You can see the sacrum right here, and the coccyx. And you can see the coccyx is very tiny compared to the sacrum. And the reason why is that of the 5 regions, the sacrum bears the most weight. So the sacrum bears the most weight among the 26 vertebrae. All right. Now, the way you name it is based on going from top going down, right? The coccyx is the lowest of the 26. Look at the coccyx. It's the lowest of the 26. But look at the size between the sacrum and the coccyx. You know the sacrum bears more weight than the coccyx. Look how tiny this is. You can break it easily, right? Now compare between cervical and lumbar. Lumbar bears more weight than cervical. Does that make sense? So as you move down, it becomes bigger in size, which means it bears more weight. Now what I also want you to know in this case is this. Coccygeal or coccyx is going to be CO. Because you can't put C, right? Now what I also need for you to know is this. Look at that image that we have here. Compare between the 3 of them. Look at the size distinction of the size among the 3 different types of vertebrae. This would be your cervical, your thoracic, and your lumbar. Lumbar tends to be a bit wider than thoracic. Thoracic is a bit bigger than your cervical. Are we okay? So what we can say is that of the 3, so on the exam, this is how I do it, okay? So I say, I reach my hand into a bag and I grab out one vertebra and I describe this to you and I ask, can you tell me which one you are looking at? In words, right? Not in sight, in words. Does that make sense? I'll say this is by far the largest of the three vertebrae. These come in more than one on your spine. Which one are you looking at? So the lumbar. Because this has more than one. There's only one sacrum. This is the largest of the three that I pick out. Does that make sense? So if I pick out three of them, and this is the largest of the three, you know it has to be either sacrum or lumbar, up to that point. And I said, this type of vertebra has more than one on your spine, which means it must be the lumbar. Does that make sense? Because the sacrum just has one, right? Are we okay in that? Yes, okay, good. So, now going back to what we have here is the cervical has a very special name on this. This is my cervical, but these are also my cervicals are here. They're very special on this. So C1 is very special. C2 is very special. C3 to C6 is very boring. And C7 is very special. Okay? So the first one, you call C1, is also known as the atlas. Okay. In Greek mythology, there's a guy who carries the globe on his shoulder, yes or no? His name is Atlas. Now, believe it or not, now make me proud. Ready? Okay. The occipital condyle sits on the atlas. Do you guys remember what the occipital condyle is at?
Yes.
You should.
It's red though.
In full.
It has the hypoglossal canal, yes or no? You asked me that question, right? Yeah, it has the hypoglossal canal, yes. So the atlas itself basically is that it supports the skull. So that's C1, okay? Now, if you look at C1, if you look at C2, this is C2 right here. Look at C2. It doesn't resemble to this one, does it? No. This is C2, and this is not C2. This is also cervical as well. C2 has a different name as well. C2 name is axis. Okay? All right. Now, what I want you to do next is this. Okay, go to the back of your neck, touch those little bumps that you have along the back of your neck, go to the base of your neck, and touch that little bump that you have. By the way, that little bump that you have is this portion right here. Is this. Those bumps right here is called a spinous process, right? So ignore that for now. Ignore that for now. So I want you to touch that little bump called spinous process at the base of your neck. You can feel that protrusion, yes or no? Based on that, that is C7, okay? So C7 has a name. It's called vertebral prominence. If something's more prominent, what does it mean? It stands out. If you touch that little bump that you have on the back of at the base of your neck, that little bump stands out, right? So for that reason, it's called vertebral prominence. C3, C4, C5, and C6 are boring. They're just called C3, C4, C5, okay? Now make sure this, and this is my little advice for you is this. If you get confused on which one's C1 and which one's C2, let me just give you an advice on this. If you know your alphabet, T comes before X. So C1 comes before C2. Alphabetically, T comes before X. Okay. So on the exam, I can mix them up. But if you know this, then there's no need to worry about this. Okay. Now, this is known as the body of the vertebra. See the body? It gets bigger, right? So let's make a note on this. The body of the vertebra, the body or the centrum of the vertebra. Have we seen the word centrum on TV? The vitamins, yes. And so in this case is that the body or the centrum of the vertebra what it does is it provides support to the vertebrae from above. Hopefully that makes sense. It should make sense. If it does make sense, look at me right now. If it does make sense. Okay. This is the centrum right here, yes or no? It provides support to the one above it, and to the one above it, and to the one above it, and so on. You see this? So if you look at the centrum of the different type of vertebrae, this one right here versus this one right here versus this one right here, what do you think, which one's bigger in your opinion? Left or right? Left, right? Therefore this must be the lumbar, right? Okay, now compare between this and this, because I can't really, which one do you think is bigger? The right or the left? Okay, there's no need to worry. There isn't much, analyzing involved. The left, right?
Well, it's our right, your left.
Okay, yeah, everything's about me right
Yeah.
now. No, just kidding. Actually, it is true though. Everything's about the patient, right? And if I were to show it to you, it's about me, correct? Okay, good. So now, so you know for a fact is this is the thoracic and this is the cervical, right? Okay, now let's do this right here. This is the first one, and this is the second one. Do you see the distinction between the two? You should, okay? So for the first one, C1, does not have a body. C2, now C2 is very unique. I want to show you C2 is this. From the top view, you see something, right? Not quite sure what it is. The side view is a projection, yes or no? All right, look at C3. See this? You see C3? Okay, this is really annoying. You see C3? Yes? Okay. Side view. There's no projection, right? So what we can say is this. C2 has a body with the odontoid process. Give me a moment on this, and I'll tell you what it is for. Look at the picture what we have here. This is the body right here. This is the body of C2. Do you see that little projection that comes up? That is called the odontoid process. Now, what is very unique about this is that C1 rotates around the odontoid process. So if I ask you this question, is this class boring? The answer is never, right? So what it does is that the C1 spins around C2 for you to say no. Does that make sense? Okay, now here's the scary part is this. If you break your neck, could you die or would you become paralyzed?
Yes.
You could have one of the two options. Okay, it all depends on when you break your neck. I'll tell you why is this. If you break your neck at C2, this piece right here, odontoid process will break off, and what it does is that when it breaks off, it's going to penetrate into the spinal cord. The spinal cord runs inside, yes or no? So when this piece breaks off, it's going to penetrate into the spinal cord, which means death is imminent. If you break your neck along the C5 and C6 per se, you're paralyzed, but you're still alive. Does that make sense? But if you break your neck right here, that means for sure there's a good chance the person would die. And so, it's one of those things. Christopher Reeve, if you guys can remember who he was, Superman? Yeah, he broke his neck on back horse riding, and then he was paralyzed. He actually broke his neck, and it was so sad. I remember coming home and I think I was in high school at that time. So what happened was that I heard that he broke his neck and he was paralyzed, and I was like, because when the movie came out, I was like really young when the movie came out, and I remember watching it on VHS. It was, you know, you guys know what is that, right? It was a tape player, and it was yeah, I saw Superman in 3 of them, all 3 episodes, you know, yeah. But yes, Jasmine.
So that little tip part is the process to
Odontoid process, yeah. Or so that's a fancy name, right? If you want a cheap name, it also has a cheap name as well. The dance, yeah. On exam, I recommend that you write this because don't write something that you will misspell on the lab exam. So, but then I like to say odontoid process because it sounds nice, right? Dance, but no, it's like it's like not special. So anyway, any question on this? Nothing good, very good. Good. I always have fun in class. Okay, now, next thing is this. You look at the spine, and I do, you know, it's like the worst thing is traffic. And then once I'm in class, it's like heaven for me, right? But then, yeah, it's true though, I like class, I like, you know, on campus and so on. So if you look at the spine itself, and what I want you to do, look is this. Look at the side view of this. So this is the front view, this is the side view, right? Now what I want you to do is this, is that if someone, no. I want you to do is this, if you can, reach the back of your back and touch the contour of your spine, you can see it changes, right? So I'm going to show you, I want to use 2 words and it means very different. Concave and convex. Concave means it dips in, convex means it comes out. Look at this right here, guys. Cervical, concave. Thoracic, convex. Lumbar, concave. And sacrum, convex. Does that make sense? So you touch your cervical, it dips in, yes? So that would be concave. So concave, you know, when things cave in, that's what it means. So the 2 words are concave versus convex. So concave means it dips in, convex means it comes out. Are we okay? So cervical, concave. Thoracic, touch your thorax from the back view. It comes out, convex. Touch the lumbar, concave, it dips in, yes? And touch the sacrum, it comes out. It will be convex. Are we okay? Good. Questions? Very good. Okay. Now let's move on to the next one. Is this? So, yes. Oh, yes.
For the sinus process and the transverse process, is it the same thing, but just looking at it at a different view?
No. So the spinous process. So that's a very good question, Jasmine. So look at this right here. It says this from whichever view you want to look at, front view or back view. Let's go with the back view, right? This is the spinous process that comes out. The transverse process are on the side, the 2 sides.
Oh.
So you have 2 transverse process and 1 spinous process. Good. Moving on. Any questions on this before I move on? Good. All right. Now this is the back view as well, right? You can actually see the spinous process. Yes. Let's move on to the next one. It says intervertebral disc. Okay. The structures of it is going to be, what you have is going to be, look at this right here, nucleus pulposus and annulus fibrosus. Okay, so nucleus pulposus is a gel-like substance. Now, before I do anything on this, I want to ask you this question, is that intervertebral disc these are found in between the vertebrae. Agree or disagree on this? Agree or disagree? Agree, right? Okay, good. Now, so what we also have is this, is that it's composed, or the composition of this is going to be what's known as composition would be annulus fibrosus. And what the next one would be nucleus pulposus. Okay. This right here is composed of fibrocartilage. And this is going to be the gel-like substance. Now the sad thing is this, as we age, the nucleus pulposus will dry up. And for that reason, it has less of a compression, it can't absorb as much. That's the reason why. Now, have we seen the word fibrocartilage? Yes. Have we seen it? What is the uniqueness of that compared to hyaline cartilage?
No perichondrium.
There's no perichondrium. What type of fibers do fibrocartilage have? What type of fibers do fibrocartilage have? Open the notes. I'm not stopping you guys. What type? I'm not in the picture. Let me step back. What type of fibers can you find in fibrocartilage?
Collagen.
Collagen. Yes, very good. Now, look at the function of the intervertebral disc. First one is it connects adjacent vertebrae. So it connects the top with the bottom. Yes, adjacent vertebrae, the top and the bottom. The next thing is this: is that it forms a joint which allows some movement. Right? So here's what we can do: is this in terms of movement-wise. We can only do a few movements in this case. Ready? Look at me right now from side view. Is this ready? Flex my neck. So when you use the word flexion and extension, this is what it means. Is this okay? Let's do the elbow. Flexion, you decrease the angle. See this? Extension, you increase the angle. Okay. Now, unlike my elbow, I can do a few more things on this. Ready? Look at me right now. It says flexion, extension, and hyperextension. Correct? In my elbow, I can only do two things: flexion, extension, but I cannot do hyperextension. I would have to break my elbow and go beyond that, and that's not feasible, right? So in that case, that you can only do two movements. We'll get into the movement later on. The last thing is this: absorb a shock for the spine. So believe it or not, when you wake up, you're a bit taller, in the morning than at night. The reason, yes, but not by much. Oh, I wish it was a lot. The reason is that when you stand up, all the weight is pushing down, which causes you to become a bit shorter. When you go to bed, this basically resumes the position how it should be, so you're a bit taller. Not very much. But let's drive. Now, what the beauty of this is this. Now, this is a scary thing that we all will confront, and especially driving, because driving is really scary. Especially if people are driving so fast, and they can't stop on time. So this is the scary part of this. Okay, so first and foremost is this. You see how these nerves come out, right? So right now, I can only give you the name. It's called spinal nerve, and we'll talk more about that later on. What happens is when you have a disc herniation, look at the disc herniation. Is the disc will move towards the back. It will apply pressure on the nerve itself, which causes you to have a few things. So does anyone know anyone who have disc herniation? Yeah, the pain is massive. I mean, the pain and the weakness that you have in that region is just there. You can't do much on it. You can do surgery, but here's the thing with the surgery is that if the surgery doesn't go right, you could become paralyzed. So you have any surgery that's involved with the spinal cord is a risk that you have to take. So you have to weigh it out. It's like you rather have a surgery and knowing there's a risk that you may become paralyzed, or you could improve, right? It's just one of those things that you have to kind of, a lot of people don't want to go through it because they're afraid. And yeah. But the scary thing is that you have any accident, car accident, that could lead to this herniation. So if you look at the way people drive on the freeway, it's scary because they can't stop in time. There's no way it's like when I stop on the freeway and then I see a car coming behind me, I'm like, please let us stop on time. I'm always afraid. It's like, anyway, but any question on this before I move on? Any question on this? And you can see this is this. So this is the back, this is like the top view, right? This is the spinous process. This is the intervertebral canal. So yes.
What would a slipped disc be?
It's the same thing. Yeah. Slip just means that it goes to the back. It slips towards the back. Yeah. Okay. Now I want you to take a little note on this. This is a cross section of your spinal cord. Okay. Now here's the thing is this. Okay? So you have what's called vertebral foramen. Now before you do anything on this, I want you to distinguish between this and the next one, intervertebral foramen. Distinguish them. Inter means in between, yes or no? Vertebral means within it, yes? Now let's look at this right here. This is an intervertebral foramen. You see the hole between the vertebrae? Yes? Okay, remove the nerve. Remove the nerve right here. This is going to be what's known as intervertebral, so in between the vertebrae. Are we okay? Now this opening right here, remove the spinal cord. This is called vertebral foramen. So if this is a vertebral foramen, if I put many of them together, they become a canal. One opening, two opening, and so on. This becomes a canal. So this right here, when you put them together, it becomes a vertebral canal. Does that make sense or no? Questions on this?
Can you explain it one more time?
Yeah. If this is my spine, right, the vertebrae, and I have one, this opening is called vertebral foramen. Okay. If I put them all together, they become one vertebral canal. It's a canal. Now this canal houses the spinal cord. So this canal houses your spinal cord. SC spinal cord, yes? Okay. Any question on this? We're good to go, right? Okay, good, fantastic. So this is your intervertebral foramen, yes or no? It's in between the vertebrae. Yes, 1, 2, it's in between. Okay, now, look at the curvatures that we have. Okay, the curvatures, so this is the curvature I was looking at right here. So I would say the curvature in this case would be the secondary curve, primary curve, and so on. So let's look at this. The curvatures at your back. So your back is not straight, right? Is it straight? No, it has curves, yes? The reason why you have curves is because you allow the spine to become more flexible for you to move and very stable. So let's make a note on this. There are two curvatures, primary and secondary. I need for you to know which one is a part of the primary and which one is a part of the secondary. And I'll tell you why. So look at your thoracic. And look at your sacral. In a baby, we're talking a newborn. This is how they are, a C shape. They can't move. They have one curve called primary curve. The moment that you can see that they shift their body-wise, so at what age do you think they can begin to shift their extremities, how they can shift from side to side? About 5 to 6 months, yes? Now, when that happens, they develop their secondary curve. So let's make a note on this. So in newborn, that's it. They only have the primary curve. Okay. Now, so look what it says up there. It says primary curve is also known as accommodation curvature, which houses the thoracic and abdominal pelvic viscera. When you see the word viscera, what does it mean to you guys? Deep organs. I mentioned this, yes or no? So it means it says, so look at me right now, it says a newborn. The back is a C-shaped back. What it does is this, it houses the organs here. They can't move. If you look at a baby, newborn, they can't move. You put it on its back and the baby's gonna be in that position, right? Now, the moment that this baby, so the moment the baby can move, that means they develop what's known as secondary curve or curvature which allows their body to shift. So if you notice that the baby can shift a bit, that is when they begin to have what's known as secondary curvature. Does that make sense? So primary is at birth. Secondary curvature develops over time. So we can say secondary curve develops over time. So primary is what you have at birth. So primary curve present at birth. Where can I find my primary curve? Which segment of the spine could I find the primary curve?
Thoracic.
Thoracic and sacral, yes or no?
Yes.
Which segment could I find the secondary curve?
Cervical.
Cervical
Lumbar.
and
Lumbar.
lumbar. Good. Okay, very good. Don't forget that. I could ask that. Questions before I move on? Well, okay, right? Okay, good. Now let's look at the abnormal curvature in this case. Okay, so look what happens is, this is you and I. We're normal because we're younger, right? Now look what happens when you hunchback. You guys have this, yes? Look what happens when we have sway back and scoliosis. So let's go a few things, okay? So hunchback, street name. We don't use street name in this class. So we have what's called kyphosis. Kyphosis is also known as hunchback. Now I want you to know in this case is this. So kyphosis is when you have the exaggerated curvature in the thoracic, right? So kyphosis is a hunchback, it's also known as hunchback, aka. So in this case, you have abnormality in the curvature, in the thoracic curvature. So hunchback is the abnormality in the thoracic curvature. This is how as you age, your height diminish. This is what happens is. So look what happens is, when you have osteoporosis, your height will diminish. And I'll show you what it means is this. And then you look at your parents, they get smaller and smaller over time, right? And there's a reason why. So, and it's a domino effect. So this is gonna be my vertebrae, side view, lateral view, right? Look what happens is, over time, the bones will begin to resort. You're losing that piece of bone. Everything collapses. And so as a result, you begin to have hunchback. It's just a part of the aging process. Whereas in kids, if they have hunchback, it's because it's just muscle, not weakness. And you notice in kids or in you guys, they always tell you this: if you exercise, you have better posture. Because when you exercise, you strengthen the muscle, which improves your posture. But in old people, it's not because they don't exercise, it's because of the osteoporosis. Any question on this? Now, sway back, that's a street name as well. So lordosis is sway back. Lordosis is sway back. Now, this could be an acquired condition, or it could be what you're born with, okay? So if it's an acquired condition, acquired means you develop this condition. What that means is this, is that this condition is developed with pregnancy. You do develop lordosis when you are pregnant. Now the next one is scoliosis. Okay, so that this is abnormality. It occurs abnormality in the lumbar curve. Are we okay? Yes? And now the last one is this scoliosis. what happened in scoliosis, guys? Does anyone know anyone with scoliosis? It's really, really painful. Okay, we don't need to think about it, but scoliosis just means what? The spine deviates sideways. So the spine deviates sideways. So it goes like this. Well, one of the famous movie actresses that passed away, she developed scoliosis when she fell off a horse when on a movie set as a young kid, which is worse because your spine has not fully formed yet, and she actually fell down from a horse on a set, and she said she developed scoliosis. And who is this wonderful actress? Elizabeth Taylor. Who is that? Oh my God! It's like I name all these like great movie stars back then, and the students just look at me like, okay, I'm like, that's okay. It shows like an age discrepancy. Okay, moving on to the next one is this. Any question on this? Any question before I move on? Yes.
You said that the playback happens when you're the girl's pregnant. Then you like your sound go back to normal.
No. Yes. So here's what I want to ask you this question is. If you look at a kid, when I say kid, that means like they're young, less than 18, okay? If you look at a person who has given birth versus a person who hasn't, there's a sign that you know for sure this person has given birth, right? And if you look at a kid who is before puberty and post puberty in women, you can distinguish them, correct? Now, if you know a person before they give birth and after they give birth, you can see that there is a curvature distinction between before and after. Yeah, but it doesn't go back. It may not be as obvious. That's obvious because but it will be there somewhat.
So our back is like that because
It does. Some people they are born with that curvature more so. But for when I say abnormal, it just means it's not like 99% or 98% or so on do not have that. Does that make sense?
Yeah.
So abnormal doesn't mean that you're just bad. It's just that you are one of the fewer that have that. But my point here is that once the pregnancy happens, and you have this condition, or not this condition, but this deviation or this exaggeration, it doesn't go back to what it was before. The exaggeration may not be as excessive as what would be during the pregnancy, but it's going to be there.
So when you get pregnant again, does it go like?
It makes it easier.
Oh.
Yeah. That's the reason why they always say is giving birth to the first kid is the toughest one. But once after the first kid, it's like the second kid is like the kid just comes out. No, I don't mean like that. It's like but it's the process is shorter in that sense. Right? I don't mean like it comes out. No. The process is not as lengthy. It's not as laborious as the first one. That's what I mean.
Thank you.
Yeah. So, guys, a lot of time when I say these things, it's like it's not meant to be condescending or it's like in any way. Okay, so yeah. And so. All right, so we can move on to this one. Okay, so we're done with the spine, right? Any question on our spine? Well, moving on to the next one, it's going to be what's called thoracic cage. Okay, so touch your thoracic cage here. Is it? Okay, front, back, and the side. Okay, so let's name the bones of this. So first and foremost is this. Your thoracic cage forms the bony framework of the chest and protects your thoracic organs, which would be the heart, the esophagus, the blood vessels, and so on. It provides attachment to the muscles of the back. Also supports the shoulder girdle and the upper limbs. I don't think we have mentioned that, have we? Okay, that's fine. Wrong class. Okay. So now let's look at the bones that are involved with this. Okay, so let's look at the structure that's involved with the thoracic cage. Actually, in hindsight, I think I like my art class better than this class because it's more spacious. This class is a bit too small. I think the reason why in the summer was better because I kept it open and there was more air coming in. But this class is so claustrophobic. It's so small. Really, it's like really small. It's like art class is like more. It's wide. is a bit more spacey, or is this like a bit claustrophobic? Okay, so let's go into the thoracic cage. In this case, the thoracic cage consists of the bones. Let's name the bones of the thoracic cage. So bones of the thoracic cage. All right, so let's begin from the back, moving towards the front. We have thoracic vertebrae. How many of these should we have? How many of these should we have? 12. Good. Let's go to this side. We have ribs. How many ribs do we have? 12 pairs. Let's go to the front. We have 1 sternum. Okay, so we're not quite done yet. So let's look at this right here. This you have 12 thoracic ribs, 12 thoracic vertebrae. You have 12 pairs of ribs, 12 on each side. Yes. You have 1 sternum, and you have these are costal cartilages. So we have 10 pairs of costal cartilages. 10 pairs of costal cartilages. So it's going to be costal cartilages. Now, when you see the word costal, it means ribs. There will be 12 pairs of costal cartilages. So, let's go with, how is it 10? 10, not 12. Okay. How is it that we have, and I didn't mention 10, yes? I don't know why I put 12. Okay. So you notice in this case is this, the costal cartilages connect the ribs to the sternum. Now, as I say that, you guys are probably wondering, it's like, but there are 12 pairs of ribs. There's only 10 costal cartilages. What does that mean? It's that the last two ribs do not connect to the sternum. Okay? So let's make a note on this. So when you look at the ribs are divided into what's known as the true ribs and false ribs. So the true ribs are going to be the first 7, 1, 2, 7, and the false ribs are 8 through 12. Are we okay? Now, why are they called true ribs? That's the question. Why are they called true ribs? The true ribs itself is this. It's because the true ribs connect to the sternum by individual costal cartilage. Read first before you guys copy. Read first. True ribs connect to the sternum by individual costal cartilage. Look at me right now, just ready? This connects to the sternum by individual costal cartilage. Are we okay? Okay. For the false ribs, these ribs can be subdivided into what's known as fused ribs and floating ribs. So for the false ribs, they can be subdivided into fused ribs and floating ribs. So the fused ribs are 8 through 10, and the floating ribs are 11 through 12. Okay. Look at the fused ribs. Why are they called fused ribs? The reason why they're called fused ribs is because ribs 8 through 10 connect to the sternum. Oh, actually, let me just rephrase this. Okay. We can say the costal cartilages for ribs 8 through 10 fuse together prior to connecting with the sternum. Are you guys ready? 8, 9, and 10, they fuse together before they connect to the sternum. And for that reason, they are called fused ribs. Okay. Now the next one is this floating ribs. So they're called floating ribs is because these ribs do not connect with sternum. The last two do not connect with the sternum. And for that reason, you only have 10 pairs of costal cartilages. So, according to what they say is that, and they have done this before, you can remove the last two ribs to have your waist smaller, but it doesn't really affect you much. And some people have had them removed, from what my students tell me. Famous people, that is. All right, so any question on this? Questions? No, right? Okay, good. Now let's look at the sternum. Okay, the sternum has 3 parts, right? Manubrium, the body of the sternum, and the xiphoid process. What is this made out of? What is the xiphoid process made out of? Make me proud. Hyaline cartilage. Good. Now I'm going to ask you something else. Is this? If you do CPR, you are going to compress on the sternum, yes or no? Right? Okay. Now if I were to ask you this question, is that where on the sternum should you compress? By the way, you never compress on the ribs because you will break them. You never compress on the costal cartilages, for heaven forbid, you will break them. You can compress as much as you want on the sternum. You will break it, but at least you revive the person. Okay. If you press on any part of this, you won't kill the person. You just break the sternum, which is okay. But if you compress on these, you will break them, and these will poke into the organ, and you will kill the person in the process, right? But let's ask the question: where along here should you not compress? It's the xiphoid process. I'll tell you why this. Well, first of all, you don't go up here and compress it. No, it's too odd, right? So you go along anywhere along this region, yes or no? You don't go up here. That's too odd. So you go along here, okay? But here's what happens: I want you to find the last portion on you, the last portion, okay? That is called the xiphoid process. What you do is you go 3 fingers above it, and that will land you into the body of the sternum. And you can compress as much as you want. The reason why is if you compress on this is a piece of cartilage, it will break off. And when it breaks off, look how sharp it is. It will puncture the liver in the process. So you're helping them and killing them at the same time, right? But that's not good. Okay, are we okay so far before I move on? Yes? Okay, good. Now, if you look at the size of your vertebrae, you can see the size, the width increases as you go down, yes? Because why? It provides more weight-bearing support, yes or no? Okay. And we're done. We're actually done for that. The next one. So all my students are back here, right? Okay, good. Okay, let's continue on this. And well, moving on to the appendicular skeleton. Okay, so let's go over the appendicular skeleton right now. And before I do anything on this, I want to review with you guys on the skeleton. And this is a review. I want you to take a picture of this. Please don't copy because I want you to participate with me, guys. So the skeleton basically has two parts, axial and appendicular skeleton. So let's do this. Axial and appendicular skeleton. Okay. For the axial, there should be a total of 80 bones. For the appendicular, there should be a total of 126 or 130. Okay. Let's go with the axial first. So the skull contains what? Make me proud. 22. Very good. Now the highways, you have one, right? Yes. And then you have the ribs. There should be a total of
24.
12 pairs or 24, right? And then you have the vertebrae, which is a part of how many should we have? 26. And then you have the sternum, which is 1. And then you have the ossicles, which gives you a total of 3 pairs or 6, right? Good. So that gives you 80. Let's go on to the appendicular skeleton. First, you have what's called the pectoral girdle, which consists of your clavicle and scapula, and there should be 2 of each, right? So 2 and 2, which gives you a total of 4, right? Yes? Now you have the next one's going to be known as your limbs, and you have the upper and lower limbs as well. So let's go with the upper limbs. So the upper limbs you have is going to be what's known as upper limbs. So for the upper limbs you have, I need to sit down on this. For the upper limbs we have the humerus. The upper limbs you have the humerus. There should be 2 humerus. You have 2 radius and 2 ulna. Are we okay? Yes. And you have what's known as 8 pairs of carpal bones, and you have 5 pairs of metacarpal bones, and you have 14 pairs of phalanges. Now these are for both upper limbs. Are we okay? Both left and right. Now for the next one, so let's do the math on this. How many should we have on this? How many bones do we have for the upper limbs? It should be a total of 30 pairs, right? Yes or no? Yes or no? It should be a total of 30 pairs, right? Are we okay? Guys, 2 plus 2 is what? 4 plus 2 is 6, right? Plus 16 is 22, yes or no? Plus 10 it would be 32. Plus 28 would be 60, right? Are we okay? Yes. Now let's go to the lower limbs. The pelvic girdle, which is composed of 2 os coxa, so it could be 2 os coxa. Okay. Now each os coxa is composed of an ilium, ischium, and pubis. All right, so 3 individual bones. 3 individual bones fused together. This is a new spell check, huh? Bones fused together to form 1 os coxa. All right. Now, for the lower limbs, you have what's known as the. Give me one moment. Okay, for the lower limbs, you have 2 femur, you have 2 tibia, you have 2 fibula, 2 patella, you have 7 pairs of tarsal bones, you have 5 pairs of metatarsal, and you have 14 pairs of phalanges of the foot, which gives you a total of 30 pairs, right? Are we okay? Are we okay with the math?
Yes.
Okay, good. Now, something I want to mention really quick is this. If you do the math part of this one, if you do the math, this is how we distinguish between 126 or 130 on the math. So let me help you with the math, guys. So let's do this. All right, so let's do this. 4 from the pectoral girdle plus 30 from the upper limbs plus, I'm sorry, it's not 30, 60 from the upper limbs plus 60 from the lower limbs plus 2 os coxa, which gives you 126. Yes or no? Or you can do something else. 130 is going to be done by 4 pectoral girdle plus 60 from the upper limbs plus 60 from the lower limbs plus 6 from 2 os coxa, which gives you 130 bones. Does that make sense or no? Okay, so let's take a picture of this. See if that makes sense or not. See if that makes sense or not, guys, on how you distinguish between 126 versus 130. Yes or no? So when people ask you the question is that what is the distinction between 126 or 130? This is what it means is the os coxa, they can count it as 2 of them, or they can count from 6, right? Because each os coxa is due to a fusion of the ilium, ischium, and pubis. All 3 bones fuse together to form one os coxa. Are we okay? Yes? Okay, so let's move on to the first one is this. So the first one is pectoral girdle. Look at this right here, it says. The pectoral girdle attaches the upper limbs to the trunk. Okay, so what we have is this. This is your trunk right here. Yes or no? This is your trunk, right? So it attaches the upper limbs, this is my humerus, to the trunk using the clavicle and the scapula. Okay, so look at this right here. The clavicle and the scapula, this is the clavicle, touch your clavicle, the collarbone, touch your scapula, the shoulder blade. They attach the upper limbs to the trunk. Now look what it says right here. It says, the pectoral girdle attaches the upper limbs to the trunk and provides attachment for the muscles that move the upper limbs. Now let's talk about the clavicle and the scapula really quick on this. Clavicle, how many clavicle do you have? 2, right? So the clavicle, which bone is it? Is it a axial bone or is it an appendicular bone? Very good. So now we can say this clavicle is going to be known as the collarbone. So on the lab exam, do not put collarbone on this. We don't use street name in this class, right? Now the clavicle connects with the sternum. Look at this right here. The clavicle connects with the sternum and the scapula. Are we okay? The scapula, on the other hand, connects, so this is called a shoulder blade. We don't use the street name in this class, but this is also known as shoulder blade. The scapula connects with the clavicle and the humerus. This is the humerus right here. Are we okay? And this is the clavicle right here. So the scapula right here, look at the scapula, look at me right now, look at the screen I mean. This is the scapula that connects with the clavicle and the humerus. Are we okay? The clavicle itself connects with the scapula and the sternum. Okay, so the take-home message is this. The take-home message is this. And you look what I wrote up there. I said the pectoral girdle attached the upper limbs to the trunk, right? The take-home message is this, is that the scapula does not connect with the axial skeleton. Are we okay? Are we okay?
You said the clavicle does not
The scapula does not. I wrote the scapula. Okay. The clavicle. The clavicle does not connect with the upper limbs, or connects with the bones of the upper limbs. Okay, so read the clavicle first. It says that the clavicle does not connect with the bones of the upper limbs, and the scapula does not connect with the exoskeleton. Does that make sense or no? So let's do this again. So you look what it says right there. It says clavicle. The clavicle connects with the sternum, right? And the scapula. The clavicle in no way connects with the humerus. The humerus is the bone of the upper limb. So it says the clavicle does not connect with the bones of the upper limbs. The scapula does not connect with the sternum nor the ribs. Okay, so make a note on this. It says that a lot of students always think that the scapula connects to the ribs. No. They are situated behind the ribs, but they have no connection to the ribs. They connect to the exoskeleton through the clavicle. Does that make sense? So what that means is this, is that the scapula does not connect with the exoskeleton. Done. Any question on that? Now, this is the beauty of the scapula right here. Is this? Do you see that little depression? Yes? Okay. So that depression right there, that is the elbow joint, the shoulder joint, I should say. The shoulder joint. So when you look at the shoulder joint, it's formed by two things. So the shoulder joint is formed by, the head of the humerus inserts into the glenoid cavity of the scapula. Or some book will use the word glenoid fossa of the scapula. You see the fossa? You see the head of the humerus? You see the fossa? It goes in. Better yet. So let me show to you on what you have here. So what we have here is this, is that this right here is your humerus. Okay? This right here is your scapula. Look at this right here. Is this ready? Goes in. Now on the lab exam, I will expect you to know left or right. So on the exam, if I ask you name the bone, that's half of the question. If I say left or right, you can put it on you and you can tell me left or right. And I can teach you this. This is easy. Left or right is really easy. Knowing the part of the bones are hard, but left or right is really easy. I can show you how to distinguish left versus right. Thank you. Okay, so we're done with this, right? Let's move on. Any questions before I move on? Okay, moving on to the next one. This is done. Now look at this right here. It's very unique in this. The scapula does not connect to the ribs. It looks like it does, and a lot of people keep asking this, but how does it stay up? It's the muscles. The muscle helps to keep the scapula up. It has no direct connection with the ribs. The muscle that you have help to keep the scapula up in its position, but besides that, there's no connection between the exoskeleton and the scapula, none whatsoever. Okay, let's move into the upper limbs. The upper limbs divide into three regions: the arm, the forearm, and the hand. So this is the arm right here, this is the forearm, and this is the hand. So let's talk about the arm. Touch your arm. Touch your arm. I want all you guys to touch your arm. Don't look at anyone, just look at me as you touch your arm. Just touch one spot and don't move. Don't disappoint me, guys. Very good. Okay, good. Touch your forearm. Very good. That was quick, right? Okay, good. All right, so I
Touch
would
the hand, we
hold
touch
this
our
the
foot.
same thing on the first day, right? So the arm itself, when you think of the arm, it goes, the region of the arm would be between the shoulder and the elbow. So the region in between the shoulder and the elbow. Okay, so any of that region would be the arm. The arm is also known as the brachium. Yes or no? Yes. Now the arm contains the humerus. What type of bone is this?
Long bone.
Yes, long bone. It's obvious, guys. If you look at it, it's longer than it's wide, right? Now, so that's what I need to know on that, okay? Now, let's go into the next one. Forearm. Touch your forearm. You should know, already know where it's at, right? This is between the, what? Between the elbow
And the wrist.
and your wrist. Very good. It's composed of what? It's composed of two bones called the
Radius.
ulna and the radius. Now, here's the next question. It says, which is which? Use your directional terminology to describe this to me. Touch your radius.
Radius is lateral.
Okay, so here's what we do is this. If I say touch, find your pulse. We always instinctively go to the outside and find the radial pulse.
Mhm.
So for that reason, the radius is more on the same size as your thumb. The ulna is on the same size as your pinky, right? So we know for a fact is that the radius is going to be lateral and the ulna would be medial. Yes or no?
Yes.
Okay. Are we okay so far? Yeah. The radius is on the lateral side and the ulna is on the medial side. If you are in a standard anatomical position, correct? So the radius is on the same size as my thumb. The ulna is on the same size as my pinky. Are we okay? Good. So we're so done with the forearm, right? Now, the next thing is this. We're going to ask about is going to be, we're going to go with the wrist, the hand, I should say. For the hand, you have, it goes from the wrist all the way to the digits, right? For the hand, you go from the wrist all the way to your digits, okay? Now, the wrist is composed of carpal bones. There are 8 of them. And you have what's called a metacarpal, and you have the phalanges. So I will come back to this in a moment, right? So you have 5 metacarpal and you have 14 phalanges. Okay, I will come back to this in a moment. So let's go through one by one. Let's begin with the humerus, the funny bone, right? So it's the longest and the strongest bone of the upper limbs. You can touch this on you right now. Touch that little bump that you have on your shoulder. When you buy a shirt for someone, let's say you want to buy a shirt for your mom or your dad or so on, you measure the distance between the 2 bumps you have from here to here, yes? That is called the greater tubercle of the humerus. It doesn't really make sense to you right now, right? So let me show you what it is. Can I borrow your humerus? Okay, so when you take this out right here, we're going to have this is called a humerus, right? This is the humerus. And if you're confused on this, the difference between the humerus and the ulna, the femur, I should say, is this. One's your thigh, one is your arm. Very distinctive, okay? And many years back, I had a student on the exam. And on the exam, you can touch the bones when I asked you for the bones in left or right. She took this up, she picked this up, and she put this on her. And I look at her, I'm like, I look at her with my eyes wide open, thinking it's a hint. Yeah. She looked at me. She looked at it again, and she put it back on. I'm like, oh no. And anyway, in any case, it says distinction. My arm, my thigh. That's obvious, right? Now, but in all fairness, it says, and let me just tell you what happened when I was a kid in class, in a science class when I was a kid. I always wish if my arm could be the longer part. I don't know why I was thinking of that. But as a kid, But in any case, it says, okay, that itself. Now compare that to the next one is going to be what's known as, no, wrong book. This is going to be known as your ulna and your radius. Okay. Compare the three of them, between the three of them. Humerus, ulna. Ulna is like a wrench, right? Mm-hmm. And the radius. Okay. The radius has a head, a round head. But look at this right here. It says distinction. You can see the humerus is the largest of the three. Okay. Now, if you touch this little bump that you have here, this is called the greater tubercle of the humerus. Touch this on you. That little bump that you have right here, when you measure the distance, between the 2 points to buy a shirt for your dad, that is the bump that you have here. Now let me show it to you on there. This bump that you have on there right here, this is the one. You see that? That is called the greater tubercle of the humerus. Tubercle is a little bump, right? A bony projection. So whenever you see the word tubercle, it's a bony projection. So, the word tubercle is a bony projection. So far, how many words do we have that means bony projection? Process. Protuberance. Very good. Now we're going to add it to our dictionary, right? Our tubercle. And we're going to add one more to it, tuberosity. These mean the same thing. The little bumps, right? So on the exam, I will ask you something like this. On the exam, I'll say, I want to buy a shirt for my dad. I want to measure the distance, the width of it. I want to measure from one point to the next. There's a little bump that I have on the shoulder that I use to measure to which bone does it belong to. The humerus. Fair enough? Now moving on to the next one is this. I also want you to do this. Okay? Touch your elbow. Okay. You should ask me which one, right? The back of your elbow. All right? Now, this is the one that you use to elbow someone, correct? Here's the reason why this. Look at the back of my humerus. There's a little depression, yes or no? The ulna has a little hinge onto it. Look what happens is they lock together. See this? Okay. So when you elbow someone in the face, you actually use this to elbow someone in the face. Does that make sense? So that is something I could ask you on the exam, but we'll get to it right now. Okay, so you see this right here? I'll show it to you again. Okay, this is the back of my humerus. This is the back of my ulna. Look at the lock, the little hook on it. It hooks onto this, right? So when you elbow someone in the face, you use this part to elbow them in the face. Okay. So now let me show you what that means. Is this ready? Okay. You see this? This is the back view of the humerus. This is this portion of the ulna, and this is the one that hooks into this to form the back of your elbow. All right, so this is the back portion. So it's called the olecranon process. So this portion right here is called the olecranon process. And that is called the olecranon fossa right here. The little depression. We'll come back and we'll see it in the lab. Okay, let's go into the forearm. Is this the forearm? So the radius and the ulna articulate. When you see the word articulate, it means connection. Okay, they connect together with each other at the proximal and distal radial ulnar joints. So right here is this. Look at this right here is this. They connect together at the proximal and distal radial ulnar joints. there is what's called the interosseous membrane. Look at this membrane right here, guys. Look at this membrane. This is called interosseous membrane. The olecranon process of the ulna. This is the olecranon process of the ulna. Look at my hook right here. Look at the hook. This is called the olecranon process of the ulna. This is the one that you use to elbow someone in the face. Does that make sense? So I can ask you this question. Is you're playing basketball with John Doe. He accidentally elbowed you in the face. Which bone process did he use to elbow you in the face? Olecranon process of the ulna, right? So let's make a note on this. So the ulna and the ulna and the humerus, they connect at the elbow. So we can make a note on this. We can say the olecranon process of the ulna inserts into the olecranon fossa of the humerus. And this forms the elbow joint. Ooh, what was that?
My book.
Okay, all right. That was an earthquake. So the olecranon process of the ulna inserts into the olecranon fossa of the humerus, which forms the elbow joint. So this right here is called the olecranon process of the ulna. Do you see this? Do you see this? Do you see this? That little hook, yes? It goes into this fossa right here. You see this is the back of your elbow, yes? So this portion right here is the one that you use to elbow someone in the face. Olecranon process of the ulna is the one you use to elbow someone in the face. Okay, now, look at your wrist. I'm going to ask you to do something for me. Is this ready? I want you to flex your wrist. Bring it towards the front. Keep it like that. Don't move. Touch the little bump that you have, the two bumps that you have. Can you feel it? Okay. So these are the bumps that you have on your radius and ulna. These are it. You see this little bump that you have on the radius? And do you see the little bumps that you have on the ulna? This is it. There we go. 1, 2. Okay? So it's the same thing as this. When you flex your elbow, you touch those two bumps. They are the bumps that we're going to look for. So these are called styloid process of the radius and ulna. So we have what's called the styloid process of the radius and ulna. So these little bumps that you have here is this styloid process of the radius and the ulna. So on the exam, I could ask you this question, is something along the lines is, I touch my wrist. As I flex my wrist, there's a little bump on the medial aspect of my wrist. Which bone does it belong to? And what is the name of that bone structure? Well, first of all, it's on the medial aspect of my wrist. So it has to be what? It's a part of the ulna, yes or no?
Yes.
Okay. Now, what is that bone structure called? Styloid process of the ulna. Are we okay? Good. Moving on. Now, so we're so much done with that. Let's go on to the next one. Is this? Okay. The hand. So you have 8 carpal. You have 5 metacarpal, and you have 14 phalanges, right? So let's go into the carpals. There are 8 of them. I'm going to type this out because it's easier for me to type than to write. So there are 8 carpals, and I will ask you this on the exam. I will ask you to write in the names, guys. So let's go to 8 carpals. So we have 8 carpals. So the 8 carpal bones, are arranged into two rows of 4. Are we okay? 2 rows of 4, right? Okay, we have the first row called proximal row, this does not have a spell check. And the distal row, okay, of 4. Now we always want to begin from lateral to medial. Okay, are you guys ready? Okay, scaphoid, that's the first one. Lunate, triquetrum or triquetral, and pisiform. These are the first 4 going from lateral to medial. Okay, so let's do this. Let's do this. Ready? So I count, going from out to in. Scaphoid, lunate, triquetrum, and pisiform. Are you guys ready? I'm gonna show you how to touch the pisiform. Ready? Okay. I want you to extend your wrist. Touch that little bump that you have. That is called a pisiform. When you fall and you break your fall, as you extend your wrist and break your fall, that pisiform is the one that you fracture. Can you feel that little bump that you have? The pisiform. Okay? Okay. Now let's go on to the distal row now. Ready? Okay. For the distal row, it's the same 4 as well. You go from lateral to medial as well. We're going to go with what's called trapezium, trapezoid, capitate, and hamate. Now, when you look at the bones in the lab, the hamate has a hook. Okay. Does that make sense? So when you look at it in the lab, that the hamate, the last one, has a little hook on it. Okay, so I always think of H for hamate, H for hook. All right. So on exam, I will give you 6 of the 8, and I'll ask you to name the 2 that are missing. And you have to write in the name on exam. Fair enough? Yes, it is. Also, I will ask you basically this, and I could also ask you something along the line of this. Okay, so I'll ask you something that makes you think. All right. So, are you guys ready? Okay. So I want to, let's say, bone X is medial to the scaphoid, but lateral to the triquetrum and proximal to the trapezoid. Name bone X. Talk it out, guys. 2 minutes. Talk it out with your neighbor.
So when he said proximal, he means proximal to the wrist, right?
Yeah.
So it would be proximal and then distal, right? Right? It's proximal and then distal, right?
Yeah.
Okay.
Okay, before you guys get confused, because I see a massive confusion on this. All right, let's do this again. Let's do this again, guys. Let's do this again.
Huh?
So you have a total of 8 bones in the carpal bones, right? So we're going to have 4. 1, 2, 3, 4, and 4 here as well, yes? So this would be proximal, and this would be distal, correct? Now, we always count from lateral to medial. So what we have is this scaphoid, lunate, triquetrum, and pisiform, yes? Now the distal one is going to be what's known as trapezium. So I'll put trapezium, trapezoid. Now don't get this confused. If you know your alphabet, I comes before O. Okay, always keep that in mind. And capitate and hamate. Okay, so now look what I wrote down. He says. So what I have here is this. Look what it says. Bone X is medial to the scaphoid. So medial means what? Towards that way, yes or no? But lateral to triquetrum. Lateral means that way. So this is triquetrum and this is scaphoid. Medial to the scaphoid, but lateral to the triquetrum. So this could be an answer. I'm not quite sure yet. Right? I'm not quite sure. It says proximal to the trapezoid. Proximal means what? That this direction. So the answer should be lunate. Okay, again. Let's do it again. Stop. Let's do it again. Okay. If you want, do it. I advise you to do it. Draw the two rows on your wrist. If you want. Because she's doing it right now, and I think that's great. So you draw basically like what I did, and just label it basically as going from out to in. Scaphoid, lunate, triquetrum, pisiform. That's the first row, the proximal row. Are we okay? Let's go on to the distal one. Trapezium, trapezoid, capitate, and hamate. Are we okay? Okay, now I gave you the bone X location. I said bone X is medial to the scaphoid. So find your scaphoid. It says medial to the scaphoid. So you're going towards my pinky, right? Direction of my pinky, yes or no? Now, bone X is lateral to the triquetrum, so we're moving back out. So you go. So the distance between the scaphoid and the triquetrum, you end up in the lunate, yes or no? Okay. Now it says what? This bone is proximal to the trapezoid. So trapezoid is more distal, yes or no? So this must be on the first proximal row. In this case, it must be the lunate. Because lunate is in between the scaphoid and the triquetrum. So if you understand this arrangement, it should be easy. Are we okay? Any question? I need more than one thumbs up, guys. Questions? Okay. You guys have to let me know yes or no. If you guys stare at me, that's fine. But it's, are we okay on this? All right, good. On exam, I will expect you to know locations of the bones using directional terminology. Ask me. Okay. No questions? Okay, moving on. Okay, now the next one is this. So going back to the next one is going to be what we have. It says that the metacarpal. Okay, the way you name the metacarpal is going to be super easy as well. So let's go on to the metacarpal on this. So for the metacarpal, there's only 5 metacarpal, and for the metacarpal, it's going to be metacarpal 1, 2, 3, 4, and 5. But here's the thing: is this metacarpal 1, it aligns with your thumb. So the first metacarpal aligns with your thumb. So touch your first metacarpal, guys. Touch your first metacarpal. This is my first metacarpal. It's on the same side as my thumb, right? So if I were to ask you this question, this metacarpal number 1 is what to metacarpal number 2? A, is it medial? Or B, is it lateral? So look at me right now. Look at me right now. Metacarpal number 1 here is what to metacarpal number 2?
Medial.
Medial.
If you're going like this, but if you're
Just look at me right now.
Oh.
Metacarpal number 1 is what to metacarpal number 2? Look at me right now. Look at me right now. Is this? I don't want to stand on here, but just imagine I'm standing on here, on this table right here, and then right here. Metacarpal number 1 is what to metacarpal number 2? Okay, there's only 2 answers, right? Okay, you guys are really, really smart. One of you guys will take the other one, and then someone else will take the other one. Okay, so now I'm gonna do is this. I want you to write your answers down. Metacarpal 1 is what to metacarpal number 2. Write down your answers. Don't screen out. Write down your answers. Write down your answers. Metacarpal 1 is what to 2? Okay, raise your hand and you put medial. Raise your hand, you put lateral. Okay, are you guys ready? Okay. So now I'm gonna do something else. Metacarpal 1 is 1 to 2. It's lateral, right? Why should it be lateral? Because I have to be in the standard anatomical position. I tricked you before, right? Is this the position I should be in?
No.
So for that reason, I asked you this, do it again, correct? So always on exam, make sure you are in the standard anatomical position. So we can say this, metacarpal number 1, carpal number 1 is length to number 2, or number 5 per se. The answer should always be lateral. Good, very good. Okay. So now let's move on to the next one. Are we okay? Yes? Okay, phalanges. How many fingers do you have per hand? How many fingers do we have per hand?
Fingers 4.
4 fingers, good. Okay. How many thumb do we have per hand? 1, okay. Now I want to ask you this question. What is the distinction between a finger and a thumb?
Amount of joints.
Let's do this. Ready? Curve your finger. How many bones do you have in a finger?
3.
Okay, look at your thumb. 2. Okay, look at your pinky. Pinky is really small. There's still 3, right? Okay, good. Okay, let's do this. Right? Guys, let's do this. Okay, so we're gonna go into phalanges. So the phalanges are bones of the digits. Okay, so digits is a safe way to say things. So we can say this. We can say all fingers have 3 phalanges. Thumbs have 2 phalanges. Okay. So we should have 4 fingers, yes? 4 times 3 is 12, yes or no? And 1 thumb, which gives us 14, yes? So we have 4 fingers, which gives you 12 phalanges, yes or no? And you have 1 thumb, which gives you 2 phalanges. Okay, which gives you a total of 14 phalanges, right? Now here's what you need to know as well as this. The phalanges, there are 3 different types of phalanges. You have proximal phalanx. Phalanx means 1. Middle phalanx. I don't care on the exam. You can put phalanges or phalanx. I don't care. And distal phalanx. Which digit does not have a middle phalanx?
Thumb.
Which digit does? The thumb. And the thumb is also known as the pollex. Wow, very good. You make my day today. Yes. So pollex. Okay, so the pollex have no, so the middle phalanx is absent in the pollex. Are we okay? All right. Samantha, ask me a question.
No.
Okay. Questions, guys. Ask me questions. Okay, so what I'm going to do now is this. I'm going to go back and I'm going to go to the syllabus and I want to see where we are at. How far behind are we? We're not that far behind. Okay, guys, so here's what we have is that, so next week, we're supposed to have an exam next Friday, right? Okay. That won't happen because we are still a chapter and a half behind. So wait, hold on. Okay, so what happens is I thought this is what I was gonna do in the morning one before I was driving. So I was gonna push the exam back by 1 day, which means next Saturday. But as I was driving, I thought about you guys, and I said that's not really fair. Is because if I were to give you everything the day before and I asked you for the next day, that's a bit too abrupt, right? So what will happen is I'm gonna move the exam by 1 week. Does that make sense? So that gives you enough time to study. Does that make sense? I'm trying to be fair for you guys, okay? So I'm gonna move the exam by 1 week, so which means I'll let you guys know in Canvas. Does that make sense? But right now we know. So right now, guys, the exam is not happening next week. Just know it for a fact. I'll let you guys know more about it in Canvas. Okay, so all right. Touch the manubrium, folks. Touch the manubrium. Yes. Go back. The other way. Yeah. No. Don't go too far back. There we go. So if you have the old book, guys, it's 208 for the older edition. If you have the new one, it's going to be 224.
So the sternal angle is right in between the body and the
Yes. All right, guys. Folks, manubrium. Yes or no? Are we done? Okay. Sternal angle. Find it. Folks, this shouldn't take you that long, folks. All right. Sternal body. Find the body. Not on you, on the sternum. Okay, find the xiphoid process. Okay, 1 minute to review. Go.
Okay, so the jugular notch is on the top, and then this manubrium.
Yeah. So here's what happens, right? Okay. Guys, I want to show you something. Folks, shh. The angle. Look at me right now. It says, when I breathe in, out, in, out. This would change as well. It says this moves a bit. For the sternum, it moves a bit. So the sternal angle is basically it's a point where the bones connect together. I won't ask you that on the exam, so don't worry.
Okay.
No, I won't. I promise. You guys are so skeptical of me right now.
I know. Can't throw that in your question. Right.
Okay, we're done, right? Let's move on to the next one, guys. The ribs. Take out the ribs. Now, the ribs you need to know left or right at the end of this. So take out the ribs. What I recommend you do is take out the longer one. Don't take out the shorter one. There should be a total of, I think, 12 in each bag. I say this, take out the long one like this, folks. Yes, that one. Take out the long one, guys. I bet you anything, someone's gonna take out the short one. I know it. I just know it. All of them is on the same side. Guys, whatever you have in your box is on the same side. It's half, yeah. All right, so let's go over this, guys. All right, so that would be the next page, folks. This would be page 226. Go to page 226, the next page in the book. Find the causal angle. When you think of an angle, you think of a turn, right? Causal angle, folks. Just take one, folks. You guys have many in your hand. Take one. Put everything back. Just take one. Take the nicest one, folks. Take the nicest one that's round. Take the nicest one. Yes. That's okay. You're good. You're good. That's good. Just take one out. That's all you need. One in your hand. That's good. That's good. Close the box. I want to see all your face. Close the box. All right. This is an angle, folks. What turns? This is an angle right here. Causal angle. Causal means what? Ribs, right? Done. Causal groove. Okay. A groove is a little depression. Flip it to the back, to the inside view. This is the causal groove right here. A little indentation. Do you see it? Touch the little indentation. Can you feel it? More along the causal angle where it turns. Can you feel it? Yes or no?
Yes.
Yes, you can feel it, right? Yes, you can feel it, right? Okay. Can you guys feel it? Yes? Yes? Okay, good. We're done. Floating ribs. If I were to ask you on a skeleton, I would ask you for floating ribs. Right now, here's what I need for you to do is this. Look at this. This is a rib. Look at this. This is a rib. The smaller it is, the more at the top it's going to be. As you go down, the rib becomes longer. Right? When you go up, it's shorter. Right? I want you guys to touch your first rib. Whichever rib you can touch, that is going to be number 2. You can't touch number 1 because why? The clavicle is blocking you from touching number 1. Does that make sense? So whatever you touch is number 2, not number 1. It's number 2, right? Are we okay? Good. Fused ribs. I can only do that on a skeleton, right? However, can I borrow your sternum? Yeah. That's nice. Okay. If I were to ask you this, I know these are causal cartilages, right? I know these are causal cartilages, but if I were to ask you, which rib does this belong to? You know, just imagine the ribs connect to this, right? Which rib does this belong to? It would be fused, yes or no?
Yes.
Which rib does this belong to? The true rib, right? Because it's okay. Does that make sense? Okay. So the floating ribs will be down here. That's obvious, right? Okay, so we're done. The head of the rib, not my head. The head of the rib. Where is that at? Okay. Here is what I want you to think of. Okay. So, are you guys ready? Okay. This is like a boomerang. Okay. No, really. So what happens is this has a hook on it. Do you see the little hook?
Yeah.
This is the head of the rib. That little hook that you have right here. The head. This is the head. Yes. This is the head. Yes.
So the head is closer to the curve.
And let me just tell you something else as well as this. So this is the head. I know a lot of you guys will ask, why can't this be it, right? There's a reason. Are you guys ready? Okay, let's move down. The neck of the rib. Okay, look at your head and look at your neck. Your head is wide. Your neck is a constriction, right? If you look at the head, it's a bit wider. What it constricts is the neck. Does that make sense? The neck is where you have the constriction of the head. Look at me right now. It says, my neck is a constriction of my head. Yes or no? See how it constricts in, right? Same thing with the neck down here. It says, this is a constriction of the neck. Of the head, I should say. Duh. Now, the next one is this, the shaft. The shaft is the longest portion. Yes or no? Are we okay? The shaft is the longest portion, right? Let's go on to the next one is this. The true rib, we're done. Look at eye. Tubercle. What does that mean? It's a little bump, a bony projection, right? You look at the bony projection. It is near to the head. The head is near to the tubercle. touch the tubercle.
Just right here, press it.
Yeah, the little bump that you have. Yes, okay. So 3 things you have on this end is this. 3 things. The head, the neck, and the tubercle. 3 things. And the shaft is the longest one. So let's go from the head towards the shaft. Ready? Let's do it together. Okay? I say it, you point out. The head, the neck, the tubercle, costal angle, costal groove, the shaft, in the exact sequence. Right? Does that make sense? Yes? Should we do it again? Let's do it again. Head. Do you have? Brandon, do you have? Do you have? Yeah. The head. Touch the head. Touch the neck. Touch the tubercle. Touch the costal angle. Touch the costal groove. Touch the shaft, the longest portion, the whole thing. Are we okay? In the exact sequence as well. Yes?
Professor, on the lab exam, if you ask what this part is, are you gonna say the tubercle, or do you guys say like rear tubercle?
No, just say the tubercle is fine.
Okay.
Yeah. Okay, now, left or right? That's the question. Okay? So I want you guys to put this on you. So on the exam, folks, on the exam, this is what you can do is this. If I put a sticker on this and I say name the structure, do not touch. Because if you touch that, that means the sticker will fall off and so on, right? So on the card, I would say do not touch. And then you touch, I would take points off. If it says do not touch, that means do not touch. If I ask you, is name the bone, and the second part is left or right, you can pick it up and put it on you. So I want you to do it now, and I ask you this. So I'm going to kind of mimic the exam. Name the bone, and well, you should get it right. And is it left or right? So if you say rib, that's half of the answer.
I think the sternum is the bone of the sternum.
This is sternal end, right?
I'm trying to think, because it connects up.
Okay, guys. Okay, guys. I want to, folks, stop. Okay. So what I want you to know is this. Okay. So this is how it should be. Ready? Okay. It's like a boomerang, right? If you look at the turn of this, put it on you. That means the head connects to your spine. Okay. And now guys, the shaft has a what's called sternal end, which connects to the costal cartilage. Okay. The shaft connects to the costal cartilage. Are we okay? So write this down, guys. The shaft connects to the costal cartilage. The head connects to your spine.
This is a shaft, right?
The shaft is the longest portion.
Yeah. This is right.
The sternal.
The sternal end.
Thank you. I thought it was more complex than that.
What was that?
I thought it was more complex.
Yeah, I don't know. Yeah, people always think it's more complex, but once I break it down, it's easy. So guys, are you guys ready? Left or right? Okay. Left or right? Okay, you guys should have the same thing. Okay. All right. Are you guys ready? Okay. I don't know what you have yet, but I'm gonna give you hints on how to find left or right. Okay. Guys, are we okay so far, guys? Let's do this right now together, and we're gonna find out left or right. It's really easy on this. Okay. And you'll be amazed how easy it is. And you'll be like, wow, it's so easy. Okay, so let's do this. Okay, ready? Okay, so the ribs. So on the exam, I would say name the bone left or right. Okay, left or right. That's the second part of the exam. Now, if you get a left or right, but you get a bone wrong, it's wrong. Because people can always guess on the left or right, but you have to name the bone first to get it right. And then the second part, I will, assess if it's right or wrong. But if the first part's wrong, it's wrong. The whole thing's wrong. Now, left or right. So let's begin on this. Okay, the head connects with the spine. Don't write. Just take a picture. I want you guys to engage with me on this. Okay. So as I do this, I want you guys to put it on you, okay? The head connects with your spine. The shaft connects with the costal cartilage. Okay. Are we okay? All right, now here's the next thing is this. Ready? Okay. The costal groove should be facing posteriorly, inferiorly. Okay, based on that, you know it's going to be left or right. Okay, so let's do this together right now. It says, don't do anything yet, because that may not make sense to you. Don't. Okay, look at me right now, because I want it to make sense. Because you can write as much as you want, and it doesn't make sense, it doesn't mean anything, okay? So I pick this up, left, right, I'm not sure, okay? Let me just do this on me first. The head connects with my spine, right? So it could be left or right, who knows? The shaft connects with my sternum. It could be right or left, who knows? Okay, now this is the defining point, is this. The costal groove is going to be facing down and back. Look at the costal groove. It's going to be facing down and back. So based on that, so look at me right now, it says, look at me right now, guys. This is the costal groove. It's facing down, see how it's facing down? And back, right? So I know this is my right side. Because if it were to be if this were to be facing up and back, it would be the left. Does that make sense? Yes. So the costal groove right here, see this? Costal groove, yes? It's going to face to the back, right? To the back, and facing down. Are we okay? Yes. So I know this is my right side. So it's not too bad, right? Yes. Left or right?
Left.
Okay. Yes. Yes.
On the exam, if you have a sticker and it's posterior to the rib, that would be costal groove, right?
Yeah, it has to be along here.
Okay.
Yeah.
And that it's a thing.
Yeah, I will be really precise with a little, it's like, yeah, trust me on this.
And then if you had it in the front, for example, that would be the
shaft,
ankle.
yeah,
Okay.
the shaft. And if I have this right here, I would put like the length of that, the whole
Okay.
thing, yeah.
Okay.
Guys, also says, on the exam, you can always ask me, like, you can say, is it pointing like this and that and so on. And I'll tell you, yes or no.
This is my right. That's right.
This is my right, yes.
My left.
Down.
Okay.
Although I said left and he took it and put it down, so I don't know what that means. I said, like, what side you have? I said the left, and he just took it and put it down.
That makes sense.
Oh, okay, then yeah.
That makes sense. I was looking at it, I was like,
Oh. And then back and posterior.
inside the box is left side or right side.
But he didn't say yes or no. I'm like,
No, he might, yeah. When you said that the shaft connects to the costal cartilage and then the sternal angle.
You guys are okay, right?
Or did you
Questions?
mean
I think this is meant was
sternal end connects to
external
sternum?
end connects to the costal cartilage. Because from there it then connects to the sternum.
Okay.
Now you know where it should end.
Which kind of makes sense. The flat end is going to connect to the other flat end. Whereas this is going to like hook onto something. Confused.
And we can just remember the one with all the stuff, just like go to where
The more normal it looks, the more towards the vertebrae.
yeah. And then also like sternal.
Guys, are we okay so far, guys? Okay, good. Moving on. We're moving on to the next one, right? So we're done with this. That was easy, right?
Yeah.
That wasn't too bad.
Professor,
Yes.
where did you get this from?
Oh. It's yours, I think.
Is it? There's
Yeah.
no number on it.
I was going from one.
Did
I take it from anyone here, guys?
What's the number on it?
There is
There
no
is
number.
there's none.
Oh.
Did I walk? Because I know I walked from station to station.
Yeah, it did, because it wasn't ours.
But it has to be from you because
I don't think. I mean, we can count them.
I don't have anything with me when I came in.
No, I know, I think you took one of theirs.
Did I take this from anyone? I don't think so, right? No, because I remember walking with you guys, so this must be yours. Yeah. Okay, moving on to the next one, guys. So we're done with the rib. We're so done with this. Let's move on to the next one. Okay, take out your vertebrae. Take out the vertebrae, guys. Take out the vertebrae. Quickly, take out the vertebrae and your sacrum. Put the ribs away, take out the vertebrae and the sacrum. You should have it. You don't have it. Okay, you go with them. They have them. So can you join with them, guys? Okay, guys, it's on page 227, folks. 227. The new book, 227. Yeah, you're right. Yeah.
No, you said 227, right?
Yeah, on the new book, though.
Yeah, this is the new book.
Really? Okay.
I don't know. I haven't done.
Yeah. Okay, let's go back to 221. The old book's 206. Yeah, let's go one more
Yeah.
page. Okay, folks. Now I want you to go over every single one of them that you can see on there. Every single one of them. Start. So page 221. 221, Esther. 221.
Why you choose such a big book?
What?
Why'd you choose the biggest book?
What you should have done was that since you have it, in the binder, you should just take half, with you and half left and right.
Alright.
But you don't want to, that's fine. I mean, some people are attached to the book. So it's like, well, let me ask you this question: is that the weight as it comes down? Guys, folks. So I'm going to give you a little advice on this, folks. Shh. Okay, everything on the bottom will support the weight of the top. Yes or no? Yes. So anything on the bottom should be bigger in size. Correct? So if you look at the three of them that we have, this right here versus this right here, which one do you think is more on the bottom? My left or my right? My left, right? Yes? So which means this should be the lumbar, this is the this is the cervical. I'm older, right? So this would be the lumbar and this would be the cervical, yes or no? Yes. So always begin at the cervical moving down. Okay, start with A. Let's move with this, guys. Start with A, folks. Because I know if I let you guys go on your own, we will never get this done. Let's go with A. Start with A, folks. I want to begin with A. Find A for me. Inferior. Folks, begin. Before we do this, logically think things out. Okay, I want you to logically think things out. First of all, is this. First of all. Inferior means what? It's on the bottom, right? So you should be looking at the bottom. Now, someone is going to ask me a good question is that how do I know this is the bottom or the top? Here's how it would be is this. If you look at the spinous process, it's going to point down. Okay. Look at me right now is this. This is the exact position how it should be. This is the top, this is the bottom. So in this case, it says inferior articular process. So it should be at the very bottom that you're looking at, yes? And in fact, these are it. Inferior articular process.
So you can say that they're lateral to the spinous process?
So they are going to be lateral to the spinous process, yes, because there are two of them, right? Yeah.
But this is superior to the...
And this is superior right here on top. It all depends on how you look at this. The top view or the bottom view.
Okay.
Oh, okay.
Guys, now once again, folks, listen, look at me right now. Look at me right now. If you look at this right here, this is the exact view how it should be. I'm looking from the top, looking down, right? If I look from the side view, the spinous process points down. Look what happened now is this. Look at the spinous process. It's pointing up. It's not how it should be. It should be pointing down. Are we okay? Does that make sense? Okay, good. today?
Yeah.
Okay, good.
See, that's like tricep.
Okay.
From the top, it's superior, and then
Yeah.
from this is inferior.
If you're, yes, yeah. Folks, once again, it says, when I say superior view, this is looking at it from top looking down, right? Inferior view means I'm looking from the bottom up. Yes or no? Okay. It came apart? Did we not see it? I'm just kidding. Yeah, what about this? Then we have, when you compare
Between them.
Between two of them?
Yeah.
So it's like the disc thing that you're talking about?
It's right here. This.
Now this might not also
So it's a hole.
Like this. Yeah.
So when they're connected, they make a hole.
Yeah.
A hole in it.
This is, I think this is the vertebral foramen, and this is the intervertebral. So it's from the side.
So okay, so the interval foramen is one side, and the other one, the vertebral foramen is the top.
Yeah. Where the spinal cord goes.
How does it
No, you only have one spinous process.
Oh, yeah, yeah.
the articular process?
Here's the spinous process. Right here.
This is the articular.
And the interval disc.
That's the squishy part that goes in between the articular process and then below that. Yeah.
Are we okay, guys? Yes?
Articular process?
And the lamina.
Are we okay? Yes. Yes. Are we okay? Oh, guys, vertebral body is this right here as well. This is your vertebral body right here, guys. Vertebral body. If you remember, I said in class, I said this reflects the size or the weight-bearing capacity. If you compare between the three different types of vertebrae, this is by far. So think of it, which one do you think that this might represent? A, is it the cervical? Or B, is it the thoracic? Or C, is it the lumbar? So look at my three. Make sure you remind me that this is yours, right? Because I'll walk around, I'll forget. So here's what we have is this, folks. Here's what we have. Here's what we have of the threes is 1, 2, 3, side by side, left to right. Which one is my cervical? My left, right? Which one is my lumbar? Right, that's obvious, right? The lumbar is wider than the thoracic, which is also wider than the cervical. Okay. Now, what does that mean? This supports more weight than anything of the three, right? Okay. The more down you go to, the more weight-bearing capacity it has. So that's the key. Weight-bearing capacity.
And then.
Guys, I also want you to think in this case as well as this, folks. Everything on the bottom is a lot thicker than everything on the top.
I guess think like the bottom is like the.
No, everything on the bottom, and here's what it means is this. Folks, one thing is this. Give me one moment of your time, folks. Folks, this is my bottom. This is my top. Why is this bigger? Because it supports more weight. Does that make sense? Okay, so the same thing with the vertebrae. As you go down, it has more weight-bearing capacity, which means it supports more weight. Okay, go. Continue on, guys.
So this is the spinous process?
Yes. Wait, are we done with A? Are we done with A?
Yeah.
Let's go on to B. Yes.
Can you show me the inferior articular process, please?
Yeah, give me one. Okay, I'm gonna ask you to do this. Position how it should be on you. Exactly. Good. Good. Okay. Now, can I? Okay. This is how it should be. Yes or no?
Yes.
Okay. Here it is. This. Look at my finger. My thumb, I should say. This is it. 1, 2. Inferior articular process. You see how it comes down?
And then the
1,
first part is
2.
lamina, and then
Which connects to the superior articular process. Aha.
Okay.
Yeah, exciting.
Oh.
but you have to, so this is how it sits on your back, and then you're looking at it like this.
Are we okay, guys? Guys, let's move on. Intervertebral foramina, right? Intervertebral foramina means what? It's an opening in between the vertebrae. Yes or no?
Yes.
Okay, so we're okay. Yes or no?
Yes.
It's an opening. Yes. Okay, let's move on to 3C. Intervertebral disc. I don't have this. I will have it in the lab. I'll show it to you guys when we get back there. Okay, next one is this. The lamina and the pedicle. That's the one I want you to look on in the book. Okay. Here's what I want you to do is this. Let's make a note on this. Let's make a note on this, folks. Let's make a note on this. Shh. Follow me on this. So we're gonna do the lamina and pedicle of this. Okay. The lamina merge to form the spinous process. Find it on your vertebra. Find it on the vertebra. The lamina merge to become the spinous process. So 2 of them on each side, 1 on each side, they come together and they form the spinous process. Are we okay? The 2 lamina merge to become the spinous process. Does that make sense? Yeah. Are we okay, guys? Yes?
So I'm guessing this is
The pedicle is the other one. Yeah.
So saying this
This is not gonna be like an indentation.
No, because if you have 2 lamina, they come together, right? And they merge and form the spinous process. 2 lamina, they merge and they form the spinous process. See this?
Oh, yeah.
So it's literally those two.
So these are the lamina right here, 1 on each side, and they merge and they become 1. Are we okay, guys? Yes?
looks like little.
Yes?
Yes.
Pedicle. That's the pedicle, yes. What?
The pedicle, yeah, there's one on each side.
Yeah, there are 2 pedicles, yes. Yes.
This is the lamina.
Yeah. Okay, so we're done with that, right? We're done with the pedicle and the lamina, yes or no? Okay, so let's move on. Okay, so let's move on to the next one, guys. Spinous process, F. 21F. Point out spinous process. Good, we're done. Let's move on to the next one. This superior articular process. Superior. If you have inferior, you gotta have superior. Yes or no?
Yes.
Okay, good. We're done, right? We're so done with that. Yes? Okay, let's move on to the next one. H. Transverse process. The lamina and the pedicle. Yeah, that's the pedicle, yes.
Transverse process is
Yeah, no, yeah, it forms the spinous process when it
is the
Guys, look at me right now. It says transverse process on the side, right? The 2 sides. Yes or no? Okay, good. Are we okay? Yes? Okay. Vertebral body. Touch the vertebral body. Very good. Vertebral foramen. Vertebral foramen. It's the opening, right? It's the opening. Yes? Okay, good. Wow, we're moving really fast.
I don't mind.
Okay, cervical vertebra. Touch your cervical vertebra. Touch the atlas. Atlas. Touch the atlas. Folks, so touch the atlas, folks. And touch the axis, folks. Touch the axis.
This little thing.
Touch the odontoid process. That little bump that you have that goes straight up, that's the odontoid process. Yes. Touch your thoracic vertebra. So on exam, I would have 3 of them side by side. I would say, name this one. So it's A, B, or C. Does that make sense? Okay, good. Are we okay so far? Am I losing anyone?
Yes.
Who? Okay, you have to listen first. Yes, ask me. Okay, atlas is the first one. So if you look at the atlas, it has no body. Remember I mentioned this in class exactly at 9:05? So that would be the axis, yes or no? Yes. Guys, ask me, folks, ask me. I'm losing you guys. Ask me. Any questions? Erica, do you want to move up here so I can see you better? No, move up. Oh, move up to the side so you can. It's you don't have to. You don't want to. You're okay, right? You guys are okay, right?
That's right.
Is this for the?
I'm losing.
Guys, folks, shh. The atlas does not have a body, folks. What was that? Folks, shh. In the lecture, I said atlas is the same thing as C1, right?
Yeah.
So it should be in sequence. Are we okay, folks? Okay, good. Moving on. Lumbar. Are we okay with lumbar? Does anyone have questions before I move on? Okay, good. Lumbar, we're done, right? Okay, let's move on to the next one. Is this?
Sacrum.
Sacrum. Let's go on to this sacrum, folks. Okay, this one is a bit tough for the sacrum. Okay. I want you guys to open to page. Can I see it? 206 for the old book. Okay, 206 for the old book. Yeah. Okay. So for the new one, it's going to be on page 222 for the new one. Go to the sacrum. The sacrum is really hard, I think. Okay.
What did you say?
What?
What did you say?
What did I say? I don't know what I said. I said a lot of things. I don't know. Yeah, I know. I said a lot of things. The sacrum is hard, guys. You have to know your sacrum well enough.
Yeah. What you mean? Okay, sacral, all
Okay. Yeah, exactly. That's the front. This is back. Guys, front, back. How do I know this is the back? Because of the ridges, right? The ridge in the back. Yes or no? Okay. Go over it, and I will test you in a few minutes. This should only take you 3 minutes at most. Okay, I'm gonna. So, do you speak Spanish? Okay, what is
Wing.
Yes, wing. Guys, I want to give you a bit of advice. So Danielle tells me ala in Spanish means wings, right? So it looks like the one that comes out. So that should help you guys somewhat. Promontory. Yeah. So guys, also this sacral promontory is that little. So guys, you see the ridge on the. So folks, look at me right now. It says the sacrum is an upside down triangle, right? Look at this right here. It's a pyramid. Yes or no?
Yeah.
The apex and the base, right? This is the body of this sacrum. At the tip of the body of the sacrum, you have what's called sacral promontory. Look at my finger. Look at my finger, guys. The tip of the body is called sacral promontory. So what happens is what they do is they measure the distance between this and the pubis during the pregnancy. They want to see how much dilation it has. Yeah, but that's beyond that. Okay, don't worry about it.
Don't worry about it. Oh, quiz.
So, but that would be sacral promontory.
This whole canal, anterior sacrum foramen is the whole.
Yeah.
Does it have to be the whole specifically between C2 and C3?
No, you have any holes. Yeah.
Okay.
Guys, if you notice what I said is this, folks, that means that there are 5 bones fused into one, right? Yes or no? You can actually see the 5 bones fused into one, right?
Yeah.
Process. Okay.
Of this.
And then
Go with that. Go with that.
median
Oh, and
sacral
the facet. The superior and the facet. The other was the process, but I guess.
Did you see the same?
there's a part poking out.
No, median sacral crest.
Median sacral crest? So this is right?
Median. Oh, that's confusing.
Sacral promontory.
It's gonna be this one.
Mira?
Okay, guys, I know someone that is confused with. Okay, guys, I can tell you this. Students always get confused between medial and median. Median is at the midpoint, exactly at the middle of the street. The median that divides the 2 parts of the street. Medial means towards the center. Guys, once again, it says, folks, shh. Median is a noun. Medial is an adjective. Medial just means towards the center, going towards the center. Median is at the very center. So when they say median sacral crest, it's the back portion of the ridge that you have on the back at the very center. So this would be right here, guys. Folks, this is called a median sacral crest.
Median sacral crest. Sacral. So he said the whole thing, right? And then sacral.
Because there are 5 bones, right? So one of the 5 bones.
It just makes it look like it's pointing at one time.
Yeah.
There's the whole.
Which on the side?
Yeah. The auriculars.
Okay,
Yeah.
the medial towards center.
And this connects with your os coxa, guys. So this connects with this right here. Can I?
Yeah.
So this connects with the os coxa. So this would be street name pelvic bone. But we don't use the street name in this class, right? So this is how it connects right here. It says, ready? This connects to that. Voila.
Legos.
So this would be your pelvis, right? Okay. Yeah. This is yours. Just make sure it goes back.
I was gonna ask.
Wait, who does this belong to?
That's mine.
Okay, 28. Fine. And this is yours as well. Because I know I took it out. Yes, yes.
Sacral hiatus. Oh, I'm
No,
gonna
guys, so here's the thing is this. All right, inside here, look at, okay, you guys don't have it because this is a fake bone. But in a real bone, there should be an opening here. See this? This is called sacral canal. What goes in? The opening on the inside. But you don't have one because it's a fake one. Sacral canal. And the spinal, the nerve from the spinal cord goes into here. That's the reason why. And I'll show it to you guys when we get back there on the real bone. We do have a real sacrum in the classroom.
Is this line or is this?
Okay.
It's this.
Sacral hiatus is the opening going out of the canal. But yours doesn't exist. I mean, because, yeah. Yeah. Think of it as, Samantha, think of it as the canal, and the opening of the canal is hiatus.
Sacral.
I showed to you, right?
Yeah, it's a, but we told us to go back and order. So
Yeah, okay, good.
we already
Yes.
know it's
Same thing. Guys, foramen means one, foramina means many, right?
Where does the spinal cord end?
The spinal cord, it ends at L1 or L2. And some books says T10. I mean, it's T12. Okay, your classmate has a good question, okay? The spinal cord is in the spine. The spinal cord does not extend all the way to the spine. The reason why is that your spinal cord does not elongate, but your spine does grow in length as you grow in height. Yes or no? So your spinal cord ends approximately at T12 to L2, L1 or L2. Don't worry, I'll tell you guys when we get to the spinal cord. So what happens is that so people ask the questions is that if you were to go in and do a spinal tap, like or to remove your CSF, for those who don't know, don't worry. You go in at L4 or L5 and not exactly at L1 because you don't want to damage the spinal cord. So the spinal cord never goes all the way to the end of the spine. And we'll talk more about that when the time comes.
But this is form. Yeah, he said it's the same thing. It's just blurry. And it's all the holes. It's where theoretically
Because there are 5 of them fused together, right?
Yeah.
So you have, yeah. Questions, guys, keep asking questions. Good questions. Yeah, the promontory, yes. Coccyx, yes.
What's the other word for it?
Coccygeal, coccygeal. Yeah. Coccyx is a noun, coccygeal is an adjective. Yes. Yeah, yeah. Guys, foramen is one, foramina means many, okay? So there are different forms. Keep asking, folks.
I'm just gonna go over again until.
Yes, go over again as often as you need to.
How long is the wing?
Yes. Yeah. What is it? Yeah, that's when they come, and this is the day where they actually expose the kids to like sciences, so different science like physics and astronomy, the bones. Yeah. Which is really interesting. This is one of the very few schools that has it, which shows you that this area is a well-off area. Or this community college is catered to the well-off, demographic. Because if you go to different colleges, they don't have these kind of programs here. Which is you can see the investment this college put into it. Which makes sense, right? This area is pretty well off, right? No? Really?
Which I think is good because it's actually the opposite. Yeah.
But don't we have a Redondo Beach and those like are well off?
So everything that's like right outside is pretty not it's
Really?
not
I always thought that this is a well off area.
So Torrance is known to be, but there are parts of Torrance that are of lower income, household
Really?
income.
So I always thought that Torrance was like a high.
Well, and then go further that way, it's a different city.
Because I live 5 minutes away in Gardena.
Yeah.
Isn't
So
it
you
Gardenia's
have-
well off as well?
No.
Really?
It used to be.
Okay, because I
That
thought
was years ago.
the price is like really high for the
It
whole.
used to be.
Okay, I didn't know.
And the prices still are really high.
Yeah.
Especially for housing. But it's still
It's
low
not well
income.
off. Wow, I never knew.
Because I moved here a year ago for my job,
Yeah.
and I work in Compton. So
Right.
I moved to Gardena, and it's like 10 minutes away.
Uh-huh.
All of it is, all of it is
I didn't know. I keep thinking like this is a well-off area. I mean, I don't go out this area because I just go on the freeway and then go home and so on. But I just thought that this is a well-off area because I know the campus is really nice, and usually
Campus is gorgeous.
yeah, and so usually the beautiful campus tends to be in a nicer area. Yeah.
But it's good though that, I mean, because they do need it. They
Yeah.
do need like,
Well, and it brings in the kids who probably won't have the best luck getting into the privates for financial
Yeah,
reasons.
yeah.
And then having this beautiful campus is another plus because it's like it draws people in. Just
And also,
from
it gives you pride of where you go. You know?
pulling the safe route, being a kid.
And that's the way of moving yourself up. You have to, right? And I think the way to move yourself up is by education. That's how I believe.
No, yeah, especially now.
But not
It's
only
the
that,
only way you can, yeah.
because if you were to have a business per se and then you make money off it, what if the business crash?
That's
Yeah,
what
and
my
you
family
lose-
deals with. We have a family business. My dad created it.
Yeah.
So it's whenever everything
Yeah.
starts shutting down, we get hit really hard.
Exactly. But if you have education, I mean, it's like, it's like they always, at least I was always taught this. If you have wealth, they can always take it away from you. But if you have an education, no one can rob you of your education because it's in there, unless they kill you. But that's a different story.
But and then now you need a master's because like I have
Yeah.
2 bachelors and
Yeah.
it's nothing.
Yeah.
You need a master's to like, especially to live in California.
Yeah, yeah.
To make the money that you can stay here. Yeah.
Okay, so are we done with the sacrum, guys? Because I see someone with a scapula and the clavicle. No, don't go there yet. No clavicle, no scapula yet. No, no, no. We're gonna go together, right? Okay. Okay. All right. Let's move on, guys, to the next one. Coccyx, right? Okay. Now let's go on to the clavicle. Now you want to go on to the clavicle, guys. Clavicle is easy, easy breezy. So clavicle, I would expect you to know left or right on the clavicle. Take out your clavicle, guys. Yes, that's the one. That is the one. Yes, that's the one. No, that's too. Wait, guys, here's it. Here, folks. If this is a clavicle and my collarbone, ooh, that would be very long. You have them. All you guys have a clavicle. Yes.
Yeah, I think Yes. I'm thinking it's the same as the red and this one goes for the sternum. Oh, and then this one goes to the
All right, guys. Take it, folks. Take out your scapula as well. After this, take out your scapula as well, folks. Yes. All right, folks, go over it. It should be on page. It should be on page 232, folks. 232 for the new one, 216 for the old one. Go over it, and then I will stop and tell you when you have. You have to talk.
Oh, okay, the last one is connected. Wait, what is it called? I think this is a left.
So it goes like quite literally towards,
We have a left one.
You have it.
and then that would connect to the sternum.
This one is the right side.
Where'd your partner go?
Does anyone have 2 clavicle in your box? Can you check if you have 2 clavicle in your box? If you have 2 clavicle, that might be clavicle.
Whatever the
Okay, so guys, 2 minutes in. That's all I need for you guys. 2 minutes. Go over in 2 minutes. 2 minutes. In 2 minutes, I want you to finish everything in 2 minutes.
So acromial and attaches to acromial. And then external and attaches to external.
Oh, this looks like the flower.
Yeah, we already know, and the tubercle tends to point down.
Okay, are we ready to move on this? Okay, acromial end and the sternal end. Distinction between them, right? Let's do this right now. So, okay, distinction between these two is this: is that acromial end and sternal end. Okay, take it out. Look at the two ends. One is bulky, one is very flat. So the acromial end is very flat, and the sternal end is very bulky. Are we okay? Yes? All right, good. The shaft, what is the shaft?
The body.
The longest portion of the bone, right? Okay. Conoid tubercle. Have we seen that before? The tubercle, yes or no?
Yes.
Okay, good. And that should be facing what? More towards the back, right? Now, here's what I want you to show you on this. Touch the clavicle on you. Beginning from the sternal end, moving towards the acromial end. I want you to look at the contour of your clavicle. Beginning from the sternal end, moving out towards the acromial end. Contour means how does it, curve. Okay, are you guys ready? Convex means it comes out, and concave means it goes in. Yes or no? Okay. The same way it goes on here as well as this. If I put this on me right now, okay, I'm not sure if it's left or right. I'm not quite sure yet, but I know for a fact is that this is the sternal end is bulky, and acromial end is flat. So I know this would be more towards the outside, this is more towards the medial. Yes or no? Okay. This could be left or right. Who knows, right? Done. Next thing is this. Ready? Okay. I know for a fact is this. The medial side will be a bit more convex, concave. Are we okay? Convex means coming out, concave means going in. So I know this could be my left or my right. Who knows? Now let's go on to the conoid tubercle. This should be facing towards the back. Yes or no? So we know for a fact this is going to be facing towards the back. So this could be left or right. Who knows again? Now, this is the defining point. It says touch the top and touch the bottom. The top is very smooth. The bottom is somewhat rugged. So you know that the top, this is my top and this is my bottom. So therefore, this is my left. Okay, so let's go over together. I'll describe this to you now. I want you to touch that. Folks, follow my instructions. I don't want to hear any voice except mine. Ready? Touch the sternal end, the bulky end. That connects to your sternum, yes or no?
Yes.
Okay. Now, touch the acromial end, the flat end. That attached with the acromion of the scapula, yes or no?
Yes.
Okay, good. We're done with that. Now, touch the shaft. The shaft, the whole shaft. Across the whole thing. Gently just cross. Okay, good. Very good. Touch the conoid tubercle. It should be facing posteriorly, yes, and somewhat inferiorly, yes or no? Are we okay? Okay, now the next thing is this. I want you to touch the top surface of the clavicle. Go across the whole thing. It's very smooth. Agree or disagree on this?
Agree.
Touch the bottom surface of the clavicle. It's very rugged. So it's not smooth, it's the opposite of smooth. Yes or no? So based on what you know, you can distinguish left versus right based on that. Are we okay? Yes?
Yes.
What do you have?
Left.
What do you have? Yeah, left or right?
Left.
Okay.
get my picture.
I'm drawing a blank on acromion. It's a part of the scapula. Acromion? Yeah. Okay, your shoulder. Okay. Oh, okay. I don't know where there is a heterochromium. I don't know. No, I just need to remember that.
Wait, that is.
But I drew a blank on like general analysis of plants. The first thing that we went over.
All right, moving on, guys. Moving on to this. You'll
Yes.
see it. Okay.
That's the only way I knew.
You guys are okay, right? Acromion of the scapula. This is the acromion right here. Ready? Okay. So first and foremost is this.
Okay. The first scapula. Yeah.
Okay. Does that make sense?
It goes on top, it don't go inside.
It goes like this.
Oh, it don't, it will connect? No.
It's a ligament that connects
Okay.
together. So both never connect like this.
Right.
They come close together, and the ligament connects this.
So in that sense, the ligament is like really small.
Ligament is more fibrous. It's like a rubber band per se. That's how they.
Okay.
All right, take out the scapula, folks. Scapula. Okay, go over that. It should be quick and simple, right?
Asking.
Yes, ask me.
Scapula.
Yes.
Okay.
You have the. You said right.
Yeah.
Okay. Wrong. It's my left one. The why? Sternum and acromion.
Oh, yeah.
With this conjoint to facing back, but down. Yes. Okay. Smooth. Rough. Touch the bottom.
This one? Oh, we're on the right
Okay.
track.
You see how bumpy it is, right?
So it's the left.
This is the left.
Oh, which is off.
So the acromial end lays on the acromial.
Touch the acromion of the scapula. Yeah. Connect.
Making the flat. Switching out.
This is acromion.
Oh, then just.
Yeah.
This one.
All right, guys, are we ready on this? Let's go into the scapula on this. I want you guys to pinpoint everything on this, and I will give you guys. I will give you guys 5 minutes on this. It shouldn't take you that long. It should be easy.
Yeah. This is okay. Thank you. And then,
I don't want to see anything out except the scapula, guys. Yes, that's it. Yes. I don't want to see the os coxa. I don't want to see anything else except the scapula. The glenoid fossa is that? Yes. The humerus goes into that, right? Remember I showed you that the humerus?
Oh, yeah.
Yeah, for the shoulder joint? Yes.
So acromion.
Yeah. The humerus goes in here. Yeah. Can I?
Okay, so the acromion is right here. Coracoid process. Yeah, coracoid process. Glenoid fossa would probably be in here. Where is it? To this.
All right, guys, this is how it should be, guys. Look at me right now as this. Look at me right now as this. Ready? Okay. Clavicle, scapula, and the humerus. Does that make sense?
And that's how being considered a ligament.
So these are here connects by ligaments, and these also connects by ligaments, but you also have what's called the rotator cuff muscles on your shoulder. We'll do it later on. Don't worry about it now.
And that's being connected by tendon.
So the rotator muscles is by tendon, yes, but these are ligaments.
Okay.
We'll do that later, so don't worry. So I saw her face and I'm like, we'll do that later.
Oh.
So then the next one is the elevator angle.
Quick process.
And inferior angle is
It
the
goes
bottom.
this way, right?
Yes.
Could be this way?
Oh, that makes sense.
Okay, guys, another hint I have for you guys is this. Touch the back of your scapula. Do you see that ridge that you have on the back? This is it. This is the spine of the scapula right here. That is the back of the scapula that you can feel. Yeah, the spine of the scapula, not the spine. Yeah.
So
So then
so
the
inside line.
shoulder blade
No,
rest.
no, no. So you can't, this is the front, this is the back. This is my back. So,
Going this way.
Oh.
so I can touch this part right
This
here.
way.
Oh.
Guys, look at me right now. This is how it's on me right now.
Okay.
I can touch this part right here on my shoulder blade in the back, right?
Okay.
So when you orient this left or right, that's what you need to know. Yeah.
This is like.
Yeah, exactly, yes.
Oh, then why is it like? Oh, because it's opposite.
Opposite side. Yeah.
And then the.
Which is the same thing. Okay, never did. I lied.
So this is the sternal and this is the acromion. This is the acromion.
Okay,
I would-
That way, right?
So I will do my right.
Because it's opposite. Yeah.
Because the arm goes in here.
Oh.
So if you have this, that means I break my arm and put it in the middle.
Okay.
That's not good.
Let me have it on that side.
Okay. Yes. Glenoid fossa, yes, I mentioned in class, right?
This one is like the flat part here. Infraspinous.
Ask me.
Lateral border or auxiliary border.
We'll talk on the next Friday. Yeah.
Just if you look at it this way. This part.
Question.
Is medial border or vertical border is all.
All right, let's do it together, guys. Acromion. Touch the acromion. Okay, touch the core process. Core process in front of the acromion, right? Good. Touch the glenoid fossa or glenoid cavity. Very good. No. Glenoid. Yeah, good. Touch the inferior angle. Okay, here's the thing is this. The angle is where the two borders merge and fuse together. This is one border, this is the second border, they fuse at the angle. Does that make sense? The angle is where the borders merge and become one piece. So infraspinous fossa. Are you guys ready? Okay, so I'm going to give you a little hint on this. Go to the back of your scapula. Find the spine of the scapula. So what we can say on this is this. We can make a note on this. We can say the spine separates the supraspinous fossa from the infraspinous fossa. So find the spine. Find the spine on your scapula. Find the spine on your scapula. The spine. Folks, this is it. This is the spine right here. Everything above it is supraspinous fossa. Everything below it would be infraspinous fossa.
Supra, infra.
Yeah, the spine, yes. And now make a note on this. Find the acromion. Find the acromion, folks. Okay, are you guys ready on this? Are you guys ready? Okay, I'm gonna make a little note on this. The acromion is an extension of the spine. Are we okay? Yes? So when you look at the acromion, go backward. So touch the acromion, move back, backward. With your fingers, move your fingers back along the acromion, going back. Exactly, that's the spine, yes. Are we okay in this? Okay, good. Keep going, keep moving.
The lateral border.
Okay, I'm gonna make a little note on this, okay? So touch your glenoid cavity or glenoid fossa. How should you face the glenoid fossa? Does it face out or in? the humerus goes into that. If it faces in, I break my arm and put it in the middle, right? So it should be facing out, right? Okay, good. So the glenoid fossa should be facing out. So make a note of it. Glenoid fossa facing laterally because the humerus inserts into glenoid fossa to form shoulder joint. Now here's the next thing I want you to know as well as this, is that, okay, that's good. Now, I also want you to know, because I did hear something that I did not like very much, which is okay, mistakes that are made during class, which is fine. The lateral border should be on the same side as the glenoid fossa. Okay? Which makes sense, right? Because it should be on the outside, yes? And guys, so when I hear things, and I hear things, I'm going to basically correct you guys by sharing the whole thing together as a class. Does that make sense? And it's more productive in that sense. Okay? So I'd rather that you make a mistake now during class time than during the exam. Okay, continue on, guys. Continue on. Inferior angle we're done, right? Lateral border we're done. Medial border we're done, right? Scapular spine we're done. Subscapular fossa. Okay, there's only 3 fossa that you have. 3. And this is the easy one. Okay, look at me right now, is this. The spine, based on that, separate the supraspinous fossa from the infraspinous fossa. So those are 2 of the 3, right? The next one says subscapular fossa. Where would it be? In the front. Okay. And you put it at eye level, right? There's a little dip to it. Do you see it? So that would be subscapular fossa in the front. Does that make sense or no? Are we okay? Yes? Okay, good. Now, we're going to go on to the next one is this. Superior angle. Where would that be at? The top, right? Okay, good. Very good. Good job. Let's go on to the next one is this. Suprascapular notch. Where is that at?
You skip border.
Oh, I skip border. Oh, yeah, that's the easy one, yeah. Yeah. I know I skipped the superior border, right? But that's the easy one, yes?
Yes. Yeah.
Exactly. So this is a notch, guys. This is a little notch and indentation, yes or no?
Yes.
Okay. And the next one would be supraspinous fossa, we're done. So we're done with that. Yes? Okay, good. Left or right? That's the next question, right? Okay. Left or right? Yes?
Could you show us the glenoid fossa?
Yeah. It's on the side right here. Glenoid fossa is right here, guys. Or glenoid cavity is on the outside. Okay. Now, here's the next thing is this. Are you guys ready? Left or right? All right, look at me right now, guys. Look at the screen, I should say. Look at the screen. I want to give you some hints on this, okay? So, scapula, left or right? Who knows, right? So let's not go on this. Ready? Okay, so first and foremost is this. These are the little hints that you should look at. Glenoid fossa, facing laterally. Done, right? Subscapular fossa, facing anteriorly. Done. That's it. Based on that, you should know left or right. Before you guys take a picture, let me just make some sense out of this. I picked this up, left or right. It could be left or right, I don't know. Let's go with this. Did I add the spine? No, I did not. The spine is always posterior, right? The subscapular fossa is facing anteriorly, and the glenoid fossa will be facing out. I know this is my left. Are we okay? Once again, let's do it again. Subscapular fossa facing to the front. Spine facing towards the back. Glenoid, fossa facing out. So I know this is my left. All right. So I'm going to add one more point to this, and you can take a picture of this. So this is going to be the spine is facing posteriorly. Okay. So take a picture of this, guys. I want to share something with you that's kind of interesting. Is this? So I was talking to one of my colleagues who teaches she teaches something in archaeology, right? And she tells me the stories how she teaches her students how to recognize the bones and then distinguish left or right. And she says she spends many days with them. And I'm thinking I spend just 2 days with my students among everything else. And she makes it so grandiose and so on. I'm thinking there are only a few things that you need to know to distinguish left or right. But that's a big thing, knowing what's left or right. So you guys are doing a good job on this. Okay, moving on to the next one. We're going to be on the humerus. Take out your humerus, guys. Take out the humerus. And your humerus is the funny bone. I want to see which one they take out. Take out the humerus. And we're going to move on to the next page right here. Yeah.
There. I don't know if there's
So it's going to be 237. No one to me.
No, I know. I'm trying to. My pages are stuck.
Okay. 237, guys. Page 237 on the new one. 221 on the old book.
Why are you laughing?
No.
The humerus?
No. It should be this way.
Oh.
It's okay.
Why are you laughing?
No, that is the tibia, Jacqueline. Yeah. Yes, that one. Yes. None. That one. That's the femur. That's the tibia. No.
So it's the long of the small one, right?
Yes.
How do you know?
No. That's good. That's good. That's good. That's good. No. Keep going.
I think you have to connect the elbows. What's the other?
This one's at the top. Okay.
Guys, let me give you an example of how the question comes. Guys, look at the question. This is how I put a sticker on exam, folks. Is this on exam? This is the type of sticker I put on exam like this. I'll say name the bone structure per se, right?
Greater tubercle.
Okay, now take out the humerus and go over everything on the humerus, guys.
Okay, so the anatomical neck has the greater tubercle in it, right?
So there are two necks, right? So let me just show you what it means, is this, guys. So that people always get confused, which is fine. So here's the thing, is this, folks. Shh, look at me right now, is this, folks. This is the head. It's round. Okay. Now, if you notice here is that the moment it constricts, it becomes a neck, right? There are two necks on this. One here. Look at my fingers. Look at my digits, I should say. Are we ready? Okay, one here and one here. There are two of them. Which one is more prone to fracture? This or this? A or B? A. For that reason, it's called surgical neck.
Oh, that's sad.
And this is more anatomical because it's thicker, right? Comparatively to the other one.
So there's
Does that make sense?
more like lines than
Yeah, and it's
spaces.
a lot. Exactly. Yeah. Capitulum. Yeah. Okay. Good. That's good. That's good that you guys are doing that. And let me help you guys on that. So I want to see where you guys are.
I hope these are not or it's this one part.
Okay.
This.
All right, guys. I'm gonna mention a few things with you guys on this. Okay, so let me just go down to here. Okay. Condyle, new name. New names right now. Actually, I mentioned this before. Have we seen the word condyle? We should have. What is it? What's condyle? I didn't hear you.
Is it cartilage?
Is this one?
Cartilage.
Condyle. Condyle. Condyle.
that's-
Condyle.
that's for
Remember
the-
on the mandible, right? On the mandible, there's a condyle. Yes or no? There's a condyle on the mandible. Go back to your notes. On the mandible, there's a condyle.
Depression?
This one here?
Condyle. Go, what is a condyle? Go back to your notes. On the mandible. And I wrote a comment on the condyle. I said I defined it for you guys. I'm
Surface
with-
for attachment?
It's a surface for attachment. Yes or no? Okay, now I will give you examples of this. Occipital condyle. Does that ring a bell? It's always true because I tell you guys. Occipital condyle, yes or no? Okay, so that's an example. So here's the thing: is this? I want you to know this. On the humerus, it connects with the ulna and the radius, but on the humerus there's no condyle, right? But it has different names. So one of the names is what's known as the capitulum 24B. So the capitulum and the trochlea basically are condyle found on the humerus. So they resemble the condyle on the humerus. So let me just make a note on this, okay, before we do anything on this. And if I put condyle, this is specific. Aren't they condyle? No. They are surface found on the fourth, found on the humerus. They resemble the condyle. That's what it means. And let me just tell you something else that Susan pointed out, and I thought it was great that they point out this. If you have epicondyle, you must have condyle. Yes or no? Look what I wrote down for you. If you have epicondyle, you must have condyle. Yes? But in this case, they have special name for the condyle. It's capitulum and trochlea. So these resemble the condyle. Okay. So these resemble the condyle. All right, does that make sense, guys? So these resemble the condyle. Okay, guys, so I'm going to stop now because we actually finished class right now. It's 12:12. Let's put everything away. I know time goes by so fast when we have